there. So I think it's worth listening to that history because we are literally and figuratively standing on the shoulder of giants. People who created things where there was none. I told her that she herself has created roads by walking, and we should be very happy that we are able to follow on their footsteps. Madam, where are you?
किसमें रखा था ना? हाँ
ये चालू कर मैं वो
कौन सा वाला खोलना? ये ना KEM
अपना हाँ Every great institution
चेंज करना है तो तू देख ले इस पे मत रख थोड़ा सा क्लोज ले ऐसे
Every great institution is built over years of dedication, innovation, and countless stories of healing. So may I request everyone to please turn your attention to the screen as we travel back in time and have a walk down the memory lane.
आ रही है इसमें ही है इसमें खुल
The 19th century was drawing to a close. India was ruled by the British. Indian students could gain admission into medical colleges, but excellent Indian doctors were denied positions they deserved. This was the time of India's struggle for independence. This is the story of a nation's pride. The 19th century was drawing to a close. India was ruled by the British. Indian students could gain admission into medical colleges, but excellent Indian doctors were denied positions they deserved. This was the time of India's struggle for independence. This is the story of a nation's pride. St. Gordandas Sundardas Medical College and King Edward Memorial Hospital were born out of the need of the nation to assert pride in itself. When Dr. KN Bahadurji was denied the post of Professor of Medicine at the Grant Medical College in favor of a much lesser qualified British officer, he approached Sir Firoz Shah Mehta and other members of the Bombay Municipal Corporation and advocated the establishment of a new medical college staffed by Indians. In 1909, the Municipal Corporation decided that the time had come for the provision of a fully equipped hospital to meet the growing needs of the north of the island. It was thought that the hospital would be a fitting tribute to the memory of the recently deceased King Edward VII, and an initial sum of Rs 5.5 lakhs was raised by the Bombay Presidency King Edward Memorial Association. The government of Bombay donated 50,000 square yards of land on the estate of the Government House at Parel, which had once served as the governor's official residence and now housed the Hafkin Institute. When Seth Gordandas Sundardas, a wealthy cloth merchant and the grandson of Mulji Jetha, died, Sir Firoz Shah Mehta, Justice Sir Narayan Chandavarkar, and Sir Chimanlal Setalvad had helped to settle the distribution of his property. As a token of gratitude, the heirs of the estate of Seth Gordandas offered rupees 12 lakhs, which was later increased to rupees 14.5 lakhs for endowing a medical college named after him. The Bombay Municipal Corporation, in an amendment, proposed that all the staff should consist of only Indian doctors. This was opposed by the then British Commissioner, Mr. Arbuthnot, on the basis that such an amendment was racist in nature. The resolution was passed in any case, and the Commissioner assured that the salaries being offered were so low that no European would accept such an appointment. The architect George Whittet, who had already designed the Gateway of India, GPO, and the Prince of Wales Museum, was appointed to plan the new hospital. The St. G.S. Medical College, the 12th medical college in the country, opened its doors on 1st of June 1925.
What a magnificent journey of 100 years. This was not just a history of a building, but a tribute to you, our alumni, and our faculty. There would be no better person to narrate the history of our Department of Radiology other than the one who has been its cornerstone for decades. A huge round of applause to Dr. Malini Nadkarni ma'am as we request her to grace the stage to narrate the history of our department.
बैकग्राउंड कुछ खोलना है ना?
We have some issues with the presentation of Nadkarni ma'am. So, may I now request our dignitaries to kindly grace the stage for lighting the lamp. I would like to request our Dean ma'am, Dr. Sangeeta Rawat ma'am, Nadkarni ma'am, Ravi sir, Himangini ma'am to please come on the dais. Let us give them a huge round of applause. Deshmukh sir, please come on the dais. ये पीपीटी का है अंडर गुरु वंदना वी हैव टू प्ले इसमें बजेगा यू वांट अस टू सिट फर्स्ट यू वांट अस टू सिट और यू द लाइटिंग यस ये तो फोटो हाँ बट एक है ये हाँ ये म्यूजिक है बट ये चल नहीं रहा है ये पीपीटी प्ले करना है हाँ ये प्ले करना है
पीछे का बंद है।
Rajiv, where are you? Come. You want to sing something? Where is madam? Madam is sitting there. I'll sit there. Hey, हाथ पकड़ना.
Yeah.
KEM Hospital and Seth GS Medical College has been Nyan Mandir for all of us. We are meeting after such a long time on the occasion of centenary year. So it's a very auspicious day. Our tradition is that any auspicious day we begin with Isha Stavan or Ganesh Stavan. Maharashtra has got a rich history of Sangeet Natak. There also every drama starts with Isha Stavan. So today I will start with what is called as Nandi of Sangeet Shakuntal, composed and written by Anna Sahib Kirloskar. पंचतुंड नररुंड मालधर पंचतुंड नररुंड मालधर पार्वतीश आदि नमितो पार्वतीश आदि नमितो विघ्नवर्गनग भग्न कराया विघ्नवर्गनग भग्न कराया विघ्नेश्वर गणपति मगतो विघ्नेश्वर गणपति मगतो पंचतुंड नररुंड मालधर पंचतुंड नररुंड मालधर कालिदास कविराज रचित है कालिदास कविराज रचित है गानी शाकुंतल रचितो गानी शाकुंतल रचितो जाणुनिया अवसान न सोनी जाणुनिया अवसान न सोनी महत्कृत्य भर शिरी घेतो महत्कृत्य भर शिरी घेतो पंचतुंड नररुंड मालधर पंचतुंड नररुंड मालधर ईश्वराचा लेश मिळे तरी ईश्वराचा लेश मिळे तरी मूढयत्न शेवटी जातो मूढयत्न शेवटी जातो या न्याये बलवत कवी निजवाक पुष्पी रसिकार्चन करीतो या न्याये बलवत कवी निजवाक पुष्पी रसिकार्चन करीतो पंचतुंड नररुंड मालधर पंचतुंड नररुंड मालधर पार्वतीश आदि नमितो पार्वतीश आदि नमितो विघ्नवर्गनग भग्न कराया विघ्नवर्गनग भग्न कराया विघ्नेश्वर गणपति मगतो विघ्नेश्वर गणपति मगतो पंचतुंड नररुंड मालधर पंचतुंड नररुंड मालधर पंचतुंड नररुंड मालधर.
It's a great pleasure for me to welcome Dr. Dara Koka. An exceptional teacher and mentor for so many of us. I get emotional, I'm sorry.
Thank you, Rajiv sir, for a beautiful start to our program and for blessing us with light and positivity. Let us now put our hands together and request our Honorable Dean Ma'am, Dr. Sangeeta Rawat Ma'am, to kindly grace the stage and share her valuable thoughts and blessings with us. A very warm welcome to you, ma'am, please.
Good afternoon and warm welcome to the 100th year of St. GS Medical College and King Edward Memorial Hospital. So welcome all of you to this alumni meet of Radiology Department of KEM Hospital. And I'm sure all of you must be remembering the old MLT, the corridors, the Dean's Lawns, and the canteen. Canteen person has changed, but we have renovated that also. And the theaters where we all have sat together, and all your radiology departments. My memory starts in radiology with my neuroradiology meetings, I think. And I think Mehar and Srinivas and Ravi, they all used to scold us for not presenting it well. And we learned our radiology from there, I think, the neuroradiology from there. So to go back to our, I think, over the last, I've now completed 3.5 to almost 3, I'll complete 4 years in January. And just to give up the updates, what we have done in this 100th year, we have started almost 7 to 8 new ICUs, which includes medical ICU, stroke ICU, HDU, liver ICU, neurology ICU, neurosurgery ICU, anesthesia ICU, urology ICU. So all those ICUs so that I get less phone calls for ventilators, but I still get equal number of calls for the ventilator and beds. Apart from that, we started the new modular theater of orthopedic, ophthal, and CVTC is almost ready, and within a week or two, we'll be inaugurating it. I will not go into details of each and everything, but we also have a robotic knee joint, robot for knee joint surgeries, and we have done almost 300 surgeries now with no additional cost to the patient. So all this we have done with the help of the CSR, with the help of MCGM and my engineering team. All have worked hard together. What we plan, the new buildings which are coming up in KEMR, first one is the service tower, Centenary Tower 1, which is already almost 10 floors are done. So we had plans that we will shift the labs there, but we may not be able to shift all the labs, but there will be the library may shift there. The radiology will have 1 or 2 floors. And then the stores will go there so that we vacate the place where we want to have a new building and the extension of laboratory. Second building which is coming up, medical humanities, I have promised them also. Second building is coming up is on the orthopedic wing, Karmachari Bhavan, which is called, which will have 2 wings, and it will have almost 100 flats for the staff of KEM, and almost 75 to 100 flats for the doctors of KEM. So probably we may get more faculty to stay around and not go over to the corporates, and as we can offer our residents to stay also. The third thing which is coming up is the nursing quarters, which is now currently we have still only the GNM nursing. We are planning to start BSc nursing, so another 400 students. So the nursing quarters has been already vacated, and we will have almost, I think, 30-storied building coming there. And after that, in between the Dean Bungalow and AD Bungalow, they both are also going to be broken. There will be a convention center, and it will have a convention center. So we'll have a 700 capacity one hall, 300 two, and then 150 and 100. So probably we won't have to, and it will also have a pre-function area, which is good. It will also have a boardroom, which is there, and it will also have a good toilets. So that we don't have to go to the 5 stars, and we can have our conferences here easily and more frequently. And next to it, where the AD Bungalow, Dean Bungalow is also going to be broken, we'll have another, I think, 20-story building where the deans and the other senior faculties will be there. So these are the 3-4 which are already sanctioned, and the work has been, the work will start. Karmachari Bhavan, already the work has started. Centenary 1 work has started. The one which I'm trying hard since 1 year is something for the patients. So during Centenary, we did something for the patients. So next to the mortuary, we renovated the Sharadini Vatika, where all the relatives of the bereaved person are sitting there, and it was very dilapidated. So we renovated that. We did two help desks for the patients and one in the CVTC where full seating area for the patients have been renovated. And we had two parklets for where across the canteen where, those who have their own tiffins, they can eat there. What we want is a new wing or a new building for the patients. So that's what our aim is. In the Centenary curtain raiser program, we had excellent program of 5 days. I'm sure all of you have seen on the online. And there DCM on the last day announced that we will have a 40-story building where we can have the patients, but it's still not, so we are planning that this, at the end of Centenary, maybe we can really have that. So where we plan that at least 5 floors of ICU, 5 floors of OT, and state-of-art things for the patients. And so these are few things which we are planning in the, before I quit my post or before I end my career. So rest all is done. The last, I hope you all good wishes are there. Then this last building also, at least we get it on paper, and building it may take lots of time. But even getting a sanction is a big thing because it will cost a lot to the MCGM. And there are so many new hospitals MCGM has already built, and they are not having people to run it. So that's why the whole thing is becoming very difficult. So I kept telling them that KEM, if you have an hospital, there will not be dearth of problem running, because we will have patients coming every day. We have 6,000 OPD patients every day, and we have almost 200 admissions every day. So if we have this, then I'm sure we can always have the faculties to, and we are, I think we all know that our KEM name is there all over the world, and our alumni all over the world. So students are always eager to come here, and I'm sure we can do better for the patients as well as for the students. So few more things which I did during Centenary. I thought, let's beautification, शादी होती है तो नए कपड़े होते हैं, तो I said KEM को भी 100th year. So we started 2 fountains, we made a gazebo, the registration counter we renovated. So a lot of things were done with MCGM, and some of things were done with CSR. And we are still trying, so we are coming up with a new burns ward, which is already ready, and a new sports center. BK Tires have given us this, and so we will have a sports, we are planning there that we have a ward of 20, we have two or three operation theater and a whole rehab machines. So probably we may be able to start MS sports medicine there in near future. So that will be. And we are hoping that CM will come next week or the first week of December to inaugurate this. And the CVTC theater has also become a new modular theater. And that also probably, we did the first transplant, but after that, the people who came and inspected, they said that these are the things which you need to change. We are just giving a provisional, certification. So we needed to change, and then, MCJ में एक चालू होता है theater, तो फिर दूसरा, तीसरा, चौथा. So all 4 theaters are becoming new, and hopefully we can start that also soon, and maybe more transplants and more complex surgeries do happen in CVTC theater. So these are few things which we are doing it. And I also entered into social media after becoming dean. I didn't know what Instagram was, except when my daughter-in-law said, designer clothes dekhna hai, to mummy isi pe dekho. So then I said, why not we, because there are reporters always there to tell the negative stories. But I said, we are doing so many good things. Who will tell about us and who will talk about us? So I learned from the resident. I still remember one of the resident accompanied me from head office to this. I said, मेरे को Instagram थोड़ा सिखा देगा? So he said, yes, madam. So in the car he taught me, and then I started doing it. So we started Instagram. Now we have more than 8,000 followers, 820 followers in Instagram. We have we started YouTube channel which has almost 3,500 subscribers, and we are also there on the Facebook and LinkedIn. So this was my idea that let's talk positive. So now the tables have turned. We just put it on the Instagram. The reporters come and ask me, madam, ये HOD का number दे दो, ये story करनी है. So that, but there are also people keep telling me, आप तो सिर्फ Facebook और Instagram में आते हो, hospital में काम करती हैं कि नहीं? So I get such comments also, and that too not from ordinary people. I get such comments from our MLAs and all also. So anyway, people are always there to speak negative. That's so you have to hear from here and take out from here. But we continue to work, and I think radiology department to Goa, they got a new CT scan, and it is a nicely done area. The whole new CT scan, I'm sure you all must have seen. We are coming with a new MRI, 3 Tesla MRI with state of art, and hope nothing comes in between. We have worked very hard for that. I and Hemangi and the whole team has worked very hard, and we have faced so many things, but finally it is almost in the pipeline, so hopefully it should be done. And we are also mostly starting the DM into IVR, and I think only the inspection is remaining, right? So I think that is Kranti, and I think Rashmi, they all are working very hard. So we were trying to do this DM since long, but finally it has piped in. And now once the inspection is done, I think we should be able to get the DM. And I think Hemangi has also got into she's starting this fertility, fetal medicines, yes, fetal medicine. And we are a center of a rare disease. So we have got a new sonography machine, which is a very high-end machine. So the fetal medicine group, this thing is also there in the, and we are also in talking terms for restarting the mammography. We had a mammography machine, but it's not working anymore. So we are negotiating with some CSR, requesting some CSR people to give us the mammography machine also. So with that, I think the radiology will have everything together. But maximum complaints radiology ka hi hoti hai. The reason for this is that people still have faith in radiology. I have a tie-up with Vadia Hospital. All the people across the MRI doing 2,500, but still they want on KEM because it's the radiologists are good in reporting. So yes, we have done an EOI for doing radiology, MRI across. So some people called me up. Okay, now this will make a lot of change. I said, I don't think it will make any change. I have done UI because I was instructed. But otherwise also they are doing it at 2,500. Across the moment the KEM form goes, people are doing it 2,500, but still we have a 6 months waiting. So he's saying, why? I said, that's because our doctors. So I think that shows, and I'm sure our alumni have done wonders everywhere not even at least in Mumbai, but all over world. That KEM alumni radiologists are famous, and that's the reason why KEM stands where it is today, because you spread the fame and name of KEM all over. So thanks once again for coming, and I'm sure you're going to have a fun-filled evening and remember all your memories and have a wonderful dinner here also. Thank you.
Thank you, Dean Ma'am, for such inspiring and encouraging words. Now I would like to request Dr. Malini Nadkarni Ma'am to narrate the history of our radiology department. Let us welcome her with a huge round of applause.
एक सेकंड हर्षिता
Hey, Lopa wanted to meet Dr. Kuka. हो गया क्या? Lopa wanted.
We'll call him to meet up.
No, she's going somewhere. No, it's all right. I should be able to stand. Acha, like this. Hello. Hello, everyone. It gives me immense pleasure to be with you all. A milestone of 100 years definitely needs celebration. KEM Hospital started on June 1st, 1925, and our department started on 31st May 1926. It was interesting going through the old records and study how the department progressed along with other facilities in the institution. I sincerely thank late Dr. Sunil Pandya and Dr. Lopa Mehta. I think she was here, she just now left, for providing me with all the old records so I could compile a history of our department. You will find that in the brochure which you will receive. Now we go down the memory lane and see how this magnificent field of radiology developed. I will enumerate salient features in the history and then work we did in KEM in early 60s and 70s. I am sure all of you know the accidental discovery of X-rays when Ranjan was working with the cathode rays. And this is the first X-ray of a human being, that is his wife's X-ray, and she was scared to see her skeleton. And she said, I have seen my death. And this is how the X-rays were done in earlier times. The X-ray tube is put on the patient's body. There is no prevention of anything anywhere. Sorry. Ranjan studied this phenomenon of radiation, and he has, whatever he postulates, he provided, there are not many changes even after so many years. So his study was so perfect. When he was convinced about this phenomenon, he studied these rays in great detail. He published his original paper on the new kind of rays in December 1895, and in a journal there in the Würzburg Physical Medical Society, and it was reported in Austrian newspapers in 1896. Generally, common people are not interested in scientific discoveries, but this discovery was viewed as a new type of photography. So initially, the magicians, artists, and advertisers started using X-rays for their own purposes. The news of this discovery immediately aroused an immense interest in the public and also initiated intense research in several directions. Physicians and physicists began as early as 1896 to use X-rays for patients to investigate the skeleton, as I showed you the X-ray. This was the birth of radiology. Sooner they observed skin erythema, which led to the idea of using X-rays for variety of skin lesions. On knowing about this history in America, yes, she can go. Okay. Okay, there is a request for felicitation of Madam.
May I request Dr. Himangini ma'am to felicitate our Dean ma'am. I'm really sorry we are sorry for interrupting you, Nadkarni ma'am, but Dean ma'am has got some urgent work. She has to leave. Himangini ma'am, kindly felicitate our guiding light and ever-inspiring Dr. Sangeeta Rawat ma'am.
It's okay, no problem. Okay. So on knowing about this discovery in America, the great inventor Thomas Edison quickly began experimenting. He developed the first fluoroscope in 1896 and he staged a public show in New York. He would demonstrate bones to the people who were curious to see. His assistant, Clarence Daly, would do this job. Many observers made the sign of cross to ward off the evil, and some of them were enthusiastic to see their bones. In 1904, Edison terminated this show because Clarence died due to adverse effects of radiation. But the modality of fluoroscopy is still in use for carrying out our dynamic studies in GI tract and interventional procedures in radiology, cardiology, neurology, orthopedics, etc. One of the properties of X-rays is that when they fall on certain crystals, these crystals emit light. And this is the phenomenon of luminescence. Edison tried to search for the best luminescent substance. He identified about 1800 such substances, of which calcium tungstate would glow about 6 times more intense than the barium platinocyanide, which was originally seen by the Röntgen. Later, this calcium tungstate became an important part of the intensifying screens which were in use till the turn of last century. Now, with new technology, the present generation may not be informed about all this. Now, this is a X-ray cassette and there are screens inside. The screens are on both sides of the cassette. It's a light, tight cassette. Another aspect of conventional radiology which is disappeared now is the darkroom processing of films. I think you saw that last, no. Okay. See, we used to have a darkroom like this with a red light on. Now, those who have seen this, they will know. Those who have not seen, they have really missed something nice. Because many times we didn't know what we were doing in that dark room. There was a red light there. And those who have worked with in earlier years will never forget the sequence of developer, fixer, water, all that, and all the stains we used to get on our clothes after using those chemicals. Coming back to the history, within 6 months of progress of new technology, X-rays were used in battlefield injuries for locating bullets. Businessmen bought X-ray apparatus and physicians referred the patients to businessmen for this special photography. It was called as photography. In 1910, the scenario changed and some physicians started to specialize in this field, and by 1920, radiology was established as a medical specialty. Around the time of discovery of X-rays, French scientist Henri Becquerel, he was working on phenomenon of phosphorescence where some crystals glow when exposed to light. But he noted that uranium salts emit some rays even if they are not exposed to light. So he started working on that. Madame Marie Curie learnt about this. She was also working to isolate the radioactive substance from the uranium ore called as pitchblende. Her scientist husband joined her in this work, and this couple, along with Dr. Becquerel, they were honored with Nobel Prize of Physics in 1903 for the discovery of radium. She coined the word radioactivity for this phenomenon. The gamma rays emitted by these isotopes and X-rays both have many properties in common, but their wavelengths differ, and the gamma rays have more penetration in the tissue, so they are used for treatment of deep-seated malignant lesions. On knowing about this usefulness of X-rays, Madame Curie helped many wounded soldiers in First World War by operating a portable apparatus in battle-stricken areas in France. She learned to operate the machine, learned to drive a car, and started a radiography training program. But she was discriminated and did not receive membership of Scientific Academy in Paris because she was a female. So that was the social structure at that time in Europe. I was fortunate to get Madame Curie's autobiographical notes. It's a wonderful book, and I have translated it in Marathi. Those of you who would like to read, you can see that. It's a really very nice book. The discovery The discovery of phenomenon called as thermionic emission by Edison or Edison effect has revolutionized X-ray tubes. This was the old Crookes tube and this was the Coolidge tube which was uh, made available in 1913. Here he had used a hot filament cathode which was made up of tungsten. The old tube was a cold cathode tube, but this was much more efficient. In 1929, Philips began production of rotating anode tubes for better dissipation of heat and performance. In year 1913, anti-scatter grid was made by Gustav Bucky. And GA company marketed Potter-Bucky grid diaphragm in 1921. This improved radiographic quality. With improvement in production of X-rays and shorter exposure time, need for rapid image recording was needed. And then initially manual cassette changers were introduced, and then motor-driven cassette changers came by 1929. LMA Shonander serial film changer came in existence in 1949. It was required for investigating cardiac and vascular diseases. In KEM, we had this technology in early 60s. Now here is a AP and lateral. These are the cassette box, AP and lateral, and the patient is on the image under the image intensifier, and that tabletop is moving. So that when we used to position the catheter there under IITV and then shift the tabletop onto the X-ray cassette and then do AP lateral radiography simultaneously. Yes. Yeah. I was fortunate to work with this technology, and I still remember all the cumbersome process of loading the films suited to demonstrate the abnormal pathways of blood flow in congenital heart disease babies and many other clinical conditions. Because we used to have cardiac and vascular together, and it was really very interesting to do that. What? Huh? No, he's Mr. Ghadi. He was a ECG technician. I think Lawrence, I might have the photo a little later. No, this was in 53. This was in 53. We used to have ECG technician also because, most of the cardiac cases, so ECG and X-ray technicians were part of our department. X-ray tomography was introduced in 1940s. The word tomography is derived from Greek word tomos means slice and graphein means to write or record. Here the X-ray tube and X-ray cassettes moved in opposite directions. Now you people know CT, you don't know what is the tomography. So here the X-ray tube and X-ray cassette, they would rotate in opposite direction with plane of interest in the center. We had this equipment, and you may be amused to know that we used to use this technology for outlining the kidney contours in cases of chronic renal failures, because the BUN used to be high, BUN creatinine, and we couldn't do. So there was a procedure called as infusion pylography. We used to give a large amount of contrast along with mixed with saline and not saline, sorry, distilled water. Saline was not indicated. And then we would do what was called as infusion pylography. So we had a procedure called as infusion pylography coupled with tomography to outline the kidneys. Now with ultrasonography, all these procedures are gone. And we used to do this tomography also to outline the cavities of fibrotic pulmonary lesions and mediastinal lymph nodes. Another innovation of 1940s was mass miniature radiography, MMR. It was developed mainly to screen a large population for early detection of pulmonary tuberculosis. Pulmonary tuberculosis used to be common even in Europe, and this was very useful tool. In KEM, initially we used to have chest fluoroscopy for OPD patients. We used to go take turns and do OPD patients, about 100 patients in one OPD setting in the morning. There was a department number 11, next to the medical OPD, there was a screening OPD, and we used to take turns and go and screen the patients. But in late 60s, I think after Dr. Kuka joined, we had stopped that practice and we installed MMR camera. Now this technology could also be used with portable apparatus to screen a large population. Especially, they used to have camps for detection of pulmonary tuberculosis in various areas. Progress of image recording. When the X-rays were discovered, technique of photography was already established. Initially, glass plates were used, but later flexible nitrocellulose-based films and papers were available. At Röntgen's request, a German plate manufacturer, Dr. Karl Schlussner, made a plate thicker than average silver bromide emulsion in 1896. But the nitrocellulose-based films were inflammable. So later on, cellulose acetate-based films replaced them. Initially, those were single-coated films, like photographic films. Soon the double-coated films started coming in with intensifying screens. But then it became difficult to process those films in a tank. And that is why those deep tanks came into practice, which I showed you some time back. The manual film processing was routine in earlier times. In 1942, automatic film processor was being developed, and by 1965, we had 90-second rapid film processing unit. Nowadays, with computer radiography and digital radiography, people may not be knowing about this film processing. In chest, now diagnostic radiology and contrast media. In chest, all four fundamental radiographic densities, that is air, subcutaneous tissue, fat, and bones, they are naturally present. But for study of abdominal organs, we needed additional contrast. So elements with higher atomic numbers would be used. Initially, bismuth, lead, and barium salts were experimentally tried. They were unsuitable. By 1910, barium sulfate and bismuth salts were used, and barium sulfate got preference because it was inert, chemically inert, and not get absorbed. For urinary complaints, cystoscopy and ureteric catheterization was known in 1901. In 1906, with refinement of ascending urography techniques, salts of bismuth, silver, and thorium as positive contrast and oxygen as negative contrast were tried, but they were unsuitable. Then there was accidental discovery of iodine as a contrast medium. In 1920s, iodine-containing compounds were used for treatment of syphilis. It was observed that the urine of patients treated with iodine salts was radio-opaque. So, search began in that direction. In 1923, use of intravenous and oral sodium iodide was described to visualize the urinary tract. But sodium iodide was too toxic. So a lot of research was put in to find out the suitable iodine compound. In 1929, the procedure of intravenous pylography was established after animal experiments and clinical trials. Now with the advent of ultrasonography, investigating various abdominal and pelvic organs is much simplified and young generation would not know about the positive and negative contrast air or oxygen X-ray examinations were available then. In earlier days, it was believed that the medicinal drug, if it is delivered in the heart, it will have a quick and better effect. So in 1929, an enthusiastic German surgeon, Werner Fossmann, tried vascular catheterization on cadavers. Then he experimented that on himself. He put in about 4 French size, flexible 65 centimeters long ureteral tube in his own arm by doing vivisection under local anesthesia. Along with a nurse who assisted him, he went to the X-ray department with the tube in the place. Under fluoroscope and with radiography, he recorded the placement of catheter in right atrium. And he nicely showed it to his boss. When he showed this film to his chief, the chief got very angry. Fossmann was dismissed from his job. But later on realization of the potential of this madness, the chief called him and reinstated him. But after more than a decade later, the procedure of cardiac catheterization was developed at Columbia University, and Fossmann was awarded Nobel Prize of Physiology and Medicine, along with Andre Cournot. And see, this is the picture of them, and Richards. Arterial studies were attempted by direct puncture of arterial cut down. Ronaldo das Santos was professor of surgery in Lisbon who introduced direct aortic puncture. Translumbar aortography remained a standard procedure for visualization of blood supply in cases of Leriches syndrome. Now this is the plate. Unfortunately, here we don't see the needle sticking in the aorta. But here you can see the kidneys are very well outlined. That is because this procedure was combined with retroperitoneal air insufflation. So that is why you can see the kidney outlines very well. We used to do this procedure mainly to look for any pheochromocytomas, which can be easily missed in on plain X-rays. Professor Egas Moniz successfully carried out carotid angiography by direct puncture. So all these were trial and error methods. Then there was bronchography. The other members of Moniz's team, they introduced pulmonary angiography, bronchography, portal venography, phlebography, etc. Now this is the plate of bronchogram. I have a very interesting story of bronchography. Bronchography under general anesthesia was the most dangerous investigation in radiology because usually it was done for children who already had low and with lung pathology would already have low lung function. Plus we are putting them in under anesthesia and putting in contrast. Now this contrast, once it is injected, we had to do very quick radiography because you didn't have time to spend. It has to be aspirated as early as possible. Unfortunately, our suction machine failed. We used to have a suction machine in the department, and Madam Budd, professor of anesthesiology, she sucked the contrast with her mouth, and the baby was saved. That was something really creditable for her. These are all stories for you people, but we have gone through all that. Now this is the case, this is lymphangiography. We used to get many cases of chyluria, lymphedemas, and our surgeons were trying to do some surgery for chyluria. So I used to do lymphangiogram. So doing lymphangiogram was another tedious procedure. We had to visualize them, cannulate them, inject them. All that would take at least about 2 to 3 hours. And then radiography. But we used to get very nice, beautiful pictures of lymphangiography. Dr. Kinman, in 1952, Dr. Kinman from England, he described lymphangiography by cannulation of lymphatics. And Kinman had visited KEM and he had donated few catheters. So with that we could do this. Now this is a splenopotogram, and previously splenopotogram was done. It is also another very risky investigation. But Dr. Bhalerao, who was our professor of radiology, he had fabricated, unfortunately I don't have the needle or the photograph of that. He had just cut a long 16 number needle, 5-inch long. He cut the hub of that needle and attached a tubing, polythene tubing to that, and that tubing was marked with centimeters. So we had to just stick in the needle in the spleen, hold the tube vertical, and measure the splenic pulse pressure, which would be indicative of portal venous pressure. Previously, people used to do this with spinal manometry, and with that, the needle became stationary, and patient would go on breathing, and chances of splenic lacerations were very high. But with Dr. Bhalerao's modification, I must have done at least more than 1,000 splenopotograms. Now, I think now with advent of technology, all these innovative procedures remain in our memories only. But we had the highest number of vascular investigations, definitely in the city and maybe also in the country. We had about 2,500 arterial angiograms, 1,000 splenophotograms, 300 lymphangiograms, etc. The concept of interventional radiology was first conceived and carried out by Dr. Charles Dotter. In 1964, he dilated a tight localized stenosis of superficial femoral artery in an 82-year-old lady who was to undergo amputation. Dr. Dotter successfully dilated the narrowed segment. He used graded diameter catheters like how we use it for esophageal or urethral dilatations. There were no big catheters at that time. This lady could walk again, and so he is rightly recognized as a father figure of interventional radiology, and this wrench and lead pipe was his trademark. Balloon dilatations and stents are used not only for blood vessels but also for other tubes like airways, urethra, ureter, esophagus, colon, in order to keep the passage open. As we can open up the passage, we can close also with embolization. Fortunately, we have Dr. Kuka today with us, who helped us initiate these procedures first time in India. So, radiology also deals with treatment. When antibiotics were not there, radiation was used for many conditions, including tuberculous lymphadenitis, thyroid nodules, etc. When I was doing my MD radiology, which was combined therapy and diagnosis, I had studied a book called Radiotherapy of Benign Lesions. It was amusing to know that radiotherapy was given for tuberculous lymphadenitis, rheumatoid arthritis, uterine fibroids, and also for sterility. So in short, this is the very fascinating branch of medicine right from its beginning. Thank you. I have written a small book, X-Files KEM, just narrating some stories. This is in Marathi. Actually, I was trying to make an English version of this, and unfortunately, Dr. Sunil Pandya passed away. I had made it, and he wanted to see that English version, and I think I'm going to send it to Ravi, and now he should make it proper. Okay? Thank you. Sorry, I overshot the time.
Thank you very much, ma'am, for taking us on a walk down the memory lane. Now I would like to call upon Dr. Dara Kukka sir, one of the senior most person present here on the dais, for sharing his valuable insights. A huge round of applause for him. So please come on the stage.
I've been taken by complete surprise, so it'll be an extempore speech. I am getting deaf, but otherwise I'm all right. And I see all these images which remind me of my history, and I'm sure Malini's. One of the things I'd like to start with is that I do not recognize many of your faces, so forgive me for that.
But we recognize you.
Thank you for telling me that I have not changed that much. But I must remember, I can remember Desai, I can remember Seema, correct? Good. One of the things I appreciated very much in KEM was initially the freedom that I was given. This is the later phase of my life, not as a student, but later. Malini is to be complimented on that. She allowed me to do what I wanted to do, which pleased me. And I think the students were brilliant. The residents, I remember, were really out of the ordinary. They would pick cases from the hospital, bring them over, we would discuss the cases, and then perhaps have a meeting with the unit from which the cases came. I think it helped me and helped the students too. I'm running short of ideas to talk of. So I think I will end here. It's a great pleasure to come here and to recognize some of you. I'm sure you're all doing very well. Thank you.
Thank you, Dr. Dara Kukka sir. Now I would like to ask Dr. Ravi sir to introduce Dr. Anil Karapurkar sir.
Anil, the trouble is, where are you here? Only old people can introduce old people. Okay, I'll call you elderly, okay, elderly. Anil Karapurkar is not a radiologist, but he's more than a radiologist, a neurosurgeon who started practicing interventional neuroradiology. And because of him, I'll keep this short, because of him, so many radiologists have gotten trained in interventional neuroradiology. Many of us worked with him, sometimes worked against him, I don't know. And then we learned, and then he is, for all practical purposes, all theory purposes, for all historical purposes, the father of interventional neuroradiology in Western India. Do not believe anything else, even something that's written on the website of the Indian Society of Neuroradiology. We are witness to that. Jaggi has worked with him, Dr. Jagdish Modi has worked with him, I have worked with him, Deshi has worked with him. All of us have worked with him, and we learned, and it was a wonderful time, and patients benefited. The best thing is that patients benefited, and a tradition has been created, which is still continuing. Rashmi, where is she? Rashmi is doing, Kranti is doing, and Anil, you should be proud, because you set up traditions. And then you went into private practice, you trained people there. Maybe Dr. Sunil Pandya was a father figure who made all of this possible. And as radiologists, we are truly grateful to you. Thank you. Come, say something. I can walk from here. I want to say something. You want me to say something? Say something. No, say something good about me.
So thank you, Ravi, for introducing me. And as you said, probably I can see many from our generation still here. I can see Srinivas, I can see Jagdish, Seema is there, Pramod is there. And you'll be surprised, you may not remember. I seem to remember that Pramod and Seema, I had given them rudiments of spine and tomography, what you mentioned. We used to do auto tomography manually. Yeah. C1, C2. Yeah. Thank you very much again. Basically, it is all because of Dr. Sunil Pandya. I would say Homi Dastur. Dr. Homi Dastur, who was the founder of our neurosurgery department, wanted that each one of us should do something different. And so we started with, we had Dr. Zayabji who came and showed us how to do transfemoral. So we started with transfemoral in 76. And from there we started doing diagnostic and then intervention. And Dr. Pandya was doing the first diagnostic angiograms and the interventions. And then after a complication that we had, he said, no, we have to have somebody who's properly trained. So I went to France and then we started. And we were doing things which were very rudimentary at that time. And until Uday came and took over, and Uday, of course, has had the department grow by leaps and bounds. And anyone anywhere would ask me, where should I go to train in neurointervention? I would say, go to Uday. I had gone to Delhi for 6 years. Sorry? Why?
You said Uday.
Yeah. Uday took over. Then he has trained so many, including Rashmi and Manish and generations of people now. Uday is also now a grandfather, if you want to call him. His students have trained others also now. So neurointervention, interventional neuroradiology, whatever, has grown because of Uday, I would say. Uday has done immense work here. So thank you everyone and have a good time. Enjoy yourselves.
Thank you, Dr. Anil Karapurkar, sir. Now I would like to ask Dr. Ravi, sir, to kindly grace the stage and say a few words.
When you have been a part of the furniture of the Department of Radiology for 40 years, you have come across so many instances, some good, some bad, some ugly, and most of them fun. So what Hemangini told me is show some fun cases. And I asked her how many hours, how many minutes? How many minutes? Now, I have got a ton of them. Please feel to. Ravi sir, stop. Okay? Fine. I'll start with this. I mean, there are at different levels and we'll have fun. So we had these 2 lockers at the back. Pramod, you remember, right at the back of the department. You go through some tunnel. Anyone who came to see me said, Ravi is going through tunnel. Anyway. So I went through tunnel and there are 2 lockers there. The one on the left was mine and the one on the right was Deshi's, right? Yeah, one on the right was Deshi's. So one morning, I used to come at 8 in the morning. I come there and there is a nice card stuck on, it's beautiful English. So there's a story behind that Sakan also. One 6-year-old boy came and he was playing around with super glue. His fingers got stuck. He said, Ravi uncle, my fingers are stuck on. So I saw that and I smiled to myself. Not because what it said, but it was signed. And this is what it said. Where is this now? How does this come next one? How to do on this? Yes. This is all brand new stuff. Huh? And okay, this is what it said. If everyone thinks like Ravi sir, no one thinks very much. I mean, I don't read slides, but I have to now. And it was signed SK. And there is only one SK in the department, and that SK was capable of this. She had known history of having fun at others' expenses. So I just smiled to myself and I started walking back through the tunnel, and what do I see? SK in front of me. Sir, did you read that? This is Friday morning, a neuroradiology meeting. So I said, yeah, I read that. How did you feel? I said, today is Friday, tomorrow is Saturday, at 2:30 we'll have a meeting, then I will show you. That Saturday came, that Saturday went. I just told everybody, please go down and see the locker. It's very nice. I mean, I didn't take out khunnas on her. This is interesting. Is Dr. Kuka here? I mean, I hope he doesn't forget these things. So there is this, I'm taking names, of people without permission, and I hope they don't mind. If they mind, it's their problem. So Dr. Kuka used to take clinics for us. And those who have seen my clinics now, Dr. Kuka is exactly the opposite. Kindness personified. Okay? No go to the 16th floor jump, no fire rounds on the basketball, none of those things. And he would help and help and help and make sure that you come out with the correct answer. So this was that. And a guy called Pankaj Doshi, okay, Rolly Poly guy, Bapu we used to call him, and Bapu was discussing this and he gave the correct diagnosis. What's happening now? Yeah, sorry, I have this habit of moving my hand all over the place. So he gave the correct answer and all that masala he said, and Dr. Kuka asked him, do you know what this is called, what this sign is called? He didn't know. Then Dr. Kuka said, this is called apple core sign. That fellow didn't understand. So Dr. Kuka explained, you know when you eat the apple, what is left? Sir, when I eat the apple, nothing is left. Okay, let's move on. Now this is amazing, completely amazing. We used to have room number 67 in the RMO's hostel. There was the permanent radiology room. In those days, the only calls we used to get, technician nahi aaya, jaake X-ray lo. That's one. The other one was carotid angiograms. So this fellow, Ashish Kapadia, professor of English language. Okay, he had trouble with English language. So he was getting calls on the phone. I mean, the phone is about 50 meters away. So somebody comes, knock, knock, phone hai aapka, he goes, listens to that. And he was somehow not satisfied. And then he created the most beautiful words in English language. Talk to me in writing. So that has become the motto of BMC. Anything you want to do with BMC, talk to me in writing. Now it's email, so life is easier. Now this is fun, ultimate fun. Dr. Kuka is discussing this case. Professor Srinivas Desai. Once upon a time, he was also a bachu. Huh? So he is discussing this case. And the thing with Srinivas, no, he has only neurons, no glial cells. I mean, he's extremely smart, has a phenomenal memory, remembers unwanted things. And so once I know him because he was just 1 year senior to me. He's younger to me in age, cheated all along, got double promotion, and became 1 year senior to me, or so he says. So he is discussing this, and Dr. Kuka is asking what else, whatever. He says, sir, brown tumor. Brilliant, huh? It was a brown tumor. Look at the trabecular pattern, all that is abnormal. And then Dr. Kuka asked him, Srinivas, tell me why it's called a brown tumor. Now, if you know Srinivas, no, there is no 100% diagnosis, 110%. Everything is 110%. Srinivas, why is it called a brown tumor? Srinivas doesn't bat an eyelid. Sir, it was discussed by Robert Brown. This is Srinivas's Robert Brown.
I know for a fact that he convinced half the room.
110% no. Professor of ecology. Okay. Now, this is very interesting. Okay. So, this patient has all sorts of masala going on in the cervical spine. And this patient belonged to a neurology unit. And that neurologist was phenomenal in clinical neurology. Amazing. You could look at a patient, walk into his clinic, and make a diagnosis. Often he was right. And he also claimed that he could do everything in radiology. There is nothing. I can catheterize the vertebral artery, I can embolize this. What is there? There is nothing in that, I will do it. When he has a manner of speaking. So he somehow liked me a lot because I was there. I told you, furniture. And then he says, Dr. Ravi, you saw that cervical spine? I said, yes, sir. What did you find? So I described all this. This is there, this is there. Show me the film. So I am very smart. No, I know he doesn't know the first thing about cervical spine. So I gave the film in his hand. He put the film up. Dr. Ravi, I agree, there is craniovertebral anomaly. क्या बोलने का अभी? I didn't say anything. I didn't want to embarrass him to put the film other way around. I said, जाने दो. Okay, let's move on. Now, this is something very interesting. Once upon a time, long ago, I used to wash up for procedures. So I was washed up in 53, and we never used to wear cap and mask. We just had, it's been shown that cap mask is a waste of time. If you're doing simple diagnostic angiogram, if you're doing intervention, it's a different thing. So no cap mask, I was washed up, and 3 people came into 53, it was in 53. A short girl, a medium girl, and 1 boy. This is Diwali time, okay? So this short girl say, sir, we have got some laddus for you, will you take? So I am saying, I'm washed up, how can I take? So the other girl is saying, sir, you open the mouth now, I'll put the laddu in your mouth. Remember, I am in the cath lab, washed up, the patient is on the table. Sir, please open your mouth, I'll put a laddu in. So I opened her mouth, she put the laddu. There's odd taste, absolutely odd taste. They had made laddu of barium powder. With no sugar. What am I supposed to do? In the cath lab, I can't spit. I had to run to the basin there. I didn't have that presence of mind. I was just mad. I didn't know that this girl will become my wife in future. I don't know how to switch off this. Okay, so this was the story of that Rava Laddu. Okay, it happened, I swallowed it and all that happened, but well, we got married anyway. Same time, Diwali time, okay? Some of you have not seen this, many of you have not seen this pass box in 53, okay? So there is a wall that separates the cath lab from the dark room, so you have this thing. So we are doing the procedure there, and suddenly there is a boom, explosion. These same or allied idiots have gone into the dark room and put a fatakada inside the pass box. And when I am there doing doom, I said, Jane do, Diwali hai, jane do. And this is very interesting. Once upon a time, for a long time, I was 48.5 kilos. I measure it in the hospital, I measure it in railway station, in Dadar, Matunga, VT, 48.5. I pressed down 48.6. Then I went up to 51.5. Unfortunately, during those days, Dr. Jagdish Mode, we used to call him Jaggi, the current chief of radiology at Hinduja Hospital, was my colleague. He was my bachu, okay? But chalta tha sab. So I said, bachu, Jaggi, I'm getting a lot of abdominal pain. Should we do a barium study and see? He said, yeah, karke dekhna, ek follow through karke dekh. I said, radiation hoega na? So this fellow is telling me, Ravi, तेरा बेरियम स्टडी करने का ना 40 वाट बल्ब रखेगा ना सब हो जाएगा. Jaggi is the master of PJs, full master of PJs. Okay, I'll come to this. So we used to do myelograms. I want to explain what a myelogram. Diagnostic. Professor Desai, what type of block is this? Intramedullary, extradural. Abhi CT mangta hai na? So we would inject by lumbar puncture, a myelogram, contrast, it will go up, get blocked, and then we want to see the upper limit, and then we inject either by external puncture, which we never did, the neurosurgeon did system, we did lateral cervical puncture. So this guy, who was this? Vinod Chablani. No, was it Vinod? Huh? Chablani, Vinod Chablani. 6 foot tall, 300 kilos. So he did this, and we said, okay, Jane, the block head, do a lateral cervical puncture. So he takes the room, the patient to the next room where there is fluoroscopy, and then he injects contrast. I mean, he injects local anesthetic. This is what we found. The one on the right. So instead of injecting local anesthetic, he had injected the same myelographic contrast material there because it was left in the syringe. And then he says, Ravi, kya karne ka? I said, aspirate. He really started aspirate. So this is Chablani's all-time. There are many stories about Chablani. This is again Jaggi, professor of phakeology, PGology. So I used to get frequent sore throat, some fever, bachu log jaise. Then one day I come at 8 o'clock. Jaggi sometimes come at 10 o'clock, sometimes 11 o'clock. He walks in whenever he wants. And then I was telling, Jaggi, late kai ko aaya in that sore throat? Ravi, your voice has become noise today. He is favored. Now I tell that to everybody, voice has become noise today. This is Dr. Kuka's most favorite. So Dr. Kuka used to sit in another floor with Dr. Nadkarni, all that, and there is a radiography machine there. There's separate technicians doing that. And one of the technicians, we used to call him darkroom attendant, was Mr. Pandey. Mr. Pandey is 5 feet nothing, rather dark, very smart features on his face, and he speaks perfect English. He was an English language teacher in Bihar and came over to here for prospects. So there are no proper technicians, if you want to call that, and there are only Mr. Pandey. Dr. Kuka wanted x-rays done of some patient, and he said, you have to hear Dr. Kuka speak. That's why I say role models. Absolute politeness. Mr. Pandey, will you please take an x-ray of the right hand of this patient, give proper exposure, and show it to me. Dr. Pandey, Mr. Pandey goes, takes an x-ray, and it's rather black like this, you can't see. So Dr. Kuka says, Mr. Pandey, will you make it better? I mean, this is a little too dark. Then Mr. Pandey comes back. Then Dr. Kuka again doesn't lose his temper, I mean, there are stories of why he has not lost temper on me also. Mr. Pandey, this is darker than the old one, no? It's black. And Mr. Pandey says, sir, the black cat always comes twice. It's famous. Out of the blue, he comes out with this quotation, the black cat always comes twice. How can we forget that? Okay, and yeah, this is interesting. Who knows the meaning of non-CB said omnibus? Very good. So my son was 6 years old or something. We were on a picnic, and Dr. Dilip Karnad, some of you know, had a cap, GS cap. So my son asked Dilip Karnad, Dilip uncle, what does this mean? And Dilip Karnad is like Jaggi, master of BJ. You don't know? Non-CB said omnibus means only by bus, not by taxi. So in the full-timers' pay, we could not afford taxis ever so often. And then, see this. Department of Radiology, off and on, we would not have films, okay? So what do the residents do? Time pass, full time pass, no kam dhanda. Not only residents, there are others from outside hospitals, former alumni would come at all times of day or night, and they would play cricket in the reporting room. And it was not unusual for me to get phone calls at 2 and 3 in the morning. Sir, GA bleed hai. Sir, carotid puncture nahi milta hai. So I would run there. That's why not by taxi, by bus. Only 66 bucks from San, take a bus and come down to the department. Takes 15, 20 minutes. So one time I got a phone call like this, 3 o'clock or 2 o'clock in the morning. Sir, GI bleed hai. हम लोग को समझता नहीं क्या है. So GI bleed means I said I'll come. So I waited for a bus, no bus. So I got into a cab, spent whatever money I had, got into the hospital, and went straight up to the angio room on the second floor. The room is locked. So I said, maybe it's locked from here, I'll go from behind and see. Nobody there. So I said, what is going on? Itna jaldi finish ho gaya kya wo log ka? So I come down to number 10, go and open the reporting room. Srinivas Desai, Jagdish Mode, and 2 or 3 other idiots are playing cricket. Huh? Suktankar. They are playing cricket. And Srinivas calls me Lolia. Arey Lolia, tu fas gaya kya? That is not the end of the story. That is the beginning of the story. So Srinivas says, Chal Dravi apan hotel mein jayega. Means what, you know? They will drink, I will watch. So I went them at 2 o'clock in the morning. I mean, he drove somewhere to this side of town, some hotel, up north. Yeah, up north. So they did the needful. And then I said, Chal, mere ko ghar chhod. Now Srinivas Desai, I'm ever grateful to him. No matter what time of the day or night, if he is with me, he has dropped me home every single time. No bus, no taxi, Srinivas Desai. And I never met with an accident with him. So, so they go somewhere here, some of the... Sorry?
Have you ever tried him when he's sober? Like asking him to drop you home?
No directional sense. He's like pigeons, he needs magnets. So I said, Chal, mere ko ghar mein chhod. He said, yeah, ghar chhodega. Then they start going towards Sion. I'm very happy. Sion aaya, Madunga, they're still going. They went down south, all the way south. And then they had something more there. So from 2 o'clock... Huh? He gave me coffee. Ravi, this is good coffee. This is Irish coffee. So Irish coffee was... My head is spinning. So anyway, so because of GI bleed, Srinivas Desai, Rajan Suktankar, and Jaggi, all of them are in high positions today. Once upon a time, not long ago, were mischievous boys. And then this is the last one. So these days it's online classes, okay? I am sitting at home with headphones on, there's a monitor in front of me, and there are bachus on the other side. This was Friday at 4:30. So there are some 10, 15 bachus in the department. I'm listening to them. Nowadays I'm very particular about English. The patient, the article is gone, the is gone, is gone. And somebody said in Indian English, if you remove all the the's where they are and put all the the's where they are not, the language is perfect. So I'm very particular and I keep telling you, won't believe, I tell them, repeat 10 times, the patient, the patient, the patient. So this was going on and towards the end was this case. And usually, you know, anyone take this case, anyone, this is happening online, and anyone, they don't have to hide. Anyone first year, second year, third year, nobody was there. And suddenly I found a name joined just now. I said, call that fellow, let him describe. So he started, it must have been a bright boy. I don't remember names. So he started with there is pulmonary oligemia, the heart size is normal, there is right ventricular configuration, the main pulmonary artery segment is hypoplastic. Sir. I said, one more time you say sir, now I will kill you. Yes, sir. Anyway, sir, this looks like tetralogy of Fallot. I said, not fallow, fallow, 3 times. Sir, this looks like tetralogy of fallow. Then I say, anything else, anything else, anything else, anything else? Yes, sir, there is a right aortic arch. I said, brilliant, that's very good. Why did you say there is a right aortic arch? No silence, immediately. Sir, because it's not a left aortic arch. Now this is top of the top NEET exams and they have too much brains. I think that's the last of it. Okay, fine, thank you. Raju, I'll tell you the story. Yes. Okay, Raju is now a senior faculty at Hinduja Hospital and she's doing a carotid puncture. At 3 o'clock in the morning, I get a phone call. Sir, there's a big problem, can you come? I said, puncture nahi milta hoega. Raju punctured the carotid artery, blood came and she fainted. Something? Yeah, something to... Abhi kya karega? The registrar has collapsed.
What an absolute delight. Thank you very much, Ravi, sir. Now I'd like to ask our former HOD and Dean of KEM Hospital, Dr. Hemant Deshmukh, sir, to share his thoughts. Let us all welcome him with a huge round of applause.
Where are they running away? So, just trying to see what they are continuing. No, I have nothing more than what Ravi and what everybody else has said. And all my seniors are sitting here. And all my colleagues, hope you remember my face. Ah, you remember. So, whatever Ravi told you about the departmental anecdotes, I was witness to everything, most of it, because I stayed with him since 1984 till 2011. Longest surviving resident.
You were second to Ravi only?
Yeah, all the time I think. Because when I joined radiology, my contact with Ravi was not in the first day of radiology, but as a medical student, when I think I had got my mother to ENT for some checkup, and those guys referred my mother for an IAM tomography. So he was the only guy in the city of Mumbai who was doing this. Yeah. And he gave me an appointment at 4 o'clock, did exactly what was required at 4 o'clock, and told me that you can go and meet your ENT surgeon, he will tell you. I don't know how they communicated with each other. Kirtani, or probably I think it was Karnik, PPK. Yeah, that was my first exposure to Ravi. And when I became the head of the department after he retired, my first day in radiology as a HOD was in the High Court of Mumbai. For whatever he did. So the first day was always in High Court, and then the entire 1 month, every day I used to go to the High Court to sort out certain issues which Ravi created. Nothing bad about it. This was about digital radiology equipment, which Ravi had tendered, done everything, all scrutiny, everything. If he has done the scrutiny, I don't think anything was wrong with the selection of the equipment. I just needed to justify why this equipment was needed. And the High Court would never listen to anybody, not even to me, not even to the opposition, whosoever was there. And eventually one day the High Court judge, and he later on became the Supreme Court judge also last time. And he said, why doesn't the radiologist speak about why he wants that radiology equipment? Then when I spoke for 2 minutes, he said, we have wasted entire month. You should have told me last time only. And that's how I think the Department of Radiology got the DR equipment, all 4 DR equipment. And that was the first day of my becoming HOD in radiology. I never did routine radiography. I always did intervention. And my first day in intervention was 1st July, I think 1986, and that was in 53. And Jaggi and Vimal is not there. There. Haan, Jaggi and Vimal were my seniors there. And whatever I learned in intervention is all because of Jagdish Modi, Vimal. And Vimal left quite early, I think. 1988, he had already left KEM. And the only radiologist that I worked full time for the last, 38 years. First was Malan, who just left. First was Vimal. Second was Malan Gandhi. Third was, anybody knows? Vanita Bandekar. Yeah, from Goa. She's not around, I suppose.
You didn't work with Ravi at all?
Ravi had already left interventional radiology probably in 1995. I don't remember him washing up. I can. He never. But there was only one time that I called him that it is becoming. There was only one time that I called him for something which I couldn't, cannulate. And he came, he tried, he also couldn't cannulate. So that was the only time that he washed up after 1995. And I remember Karapurkar sir. You remember our technician, Shinde. Yeah, he used to be always behind APK as a technician for all angiographies, whatever plain X-rays. One fine day he came running and said, "Sir, puncture के लिए आ जाओ." Puncture the non-palpable femoral artery. We are trained in that. Then I went there. Sir, I think if it's not palpable, probably coarctation of aorta hoga. And it was the same patient who had intracerebral aneurysm. So I punctured. We did an iotogram. It was a bald iotogram. Yeah. Yeah, carotid cavernous fistula. I don't remember, but then I tried to show him that this was coarctation of aorta. Bald aorta, no intercostal arteries. Why no intercostal arteries? Obviously, the collateral circulation was coming from above. So that was when we encountered neurosurgeons and neuroradiologists. And later on, once everybody left, the millennium started and all devices came into picture, we had a lot of rush of interventional radiologists who wanted to join KEM radiology. And the longest period that I worked was Kranti Kumar. Haath kidhar hai? Then we have Bhavesh. Left. Kranti Kumar and Bhavesh were the longest serving interventional radiologists, at least with me. And they continue the tradition now. At least Kranti continues the tradition now. Bhavesh had already left probably in 2015 or 16, something. And I don't know, the entire interventional neuroradiology was separate, so we continued to do only interventional peripheral radiology. And Rutvik, right? Just Rutvik came, I could recognize him. So that was interventional radiology for me all the time. And between 1995 and 2005, there were two interventional radiologists who continued with me for a short period of time. And that was Harshavardhan Shotri from Pune. You remember Harshu? Yeah. And Ravi Kumar from Chennai. I think Ravi Kumar is doing very well. Harshavardhan is doing very well in his field of dramatics, I should say. What is that perfect word? Theater. Yeah. So interventional radiology is becoming, you know, and then I think Rajan does a lot of good photography, right? Rajan? Yeah, he was the first, what you say, mm, first resident, not, I'm trying to place you as a external candidate, right? He was the first external candidate for MD radiology. Till then, most of the radiologists would come from the city of Mumbai or Maharashtra. He was the first guy coming from Bihar. And, right? कौन? हाँ, बाहर का छोकरा था. But then he did very well, I think. He was a gold medalist in DNB, right? If I am not mistaken. Yeah. So that was Rajan Chowdhury. And then after 2011, when Bhavesh left, Kranti Kumar continues, and an opportunity came for me to become the dean of this hospital. And I did not say no for the simple reason that something could have been done for radiology. And I thought I could do something. Like the dean said that she got CT scan, she got MRI. I thought I can also get something. But 2019 or something, COVID struck, and then we were just, all stuck by the entire virus, and we couldn't do anything much in radiology. The entire equipment was spoiled because there were a lot of, the sprays. I don't know what sprays were they, but most of the equipment which was all there got spoiled, and none of the, residents were not there. There was hardly any teaching going on in radiology because nobody was trying to come physically in the classrooms or the department. You remember, right? Yeah. So that was the first time that the value of X-ray chess came. It was not the HRCT chess, but the X-ray, digital X-ray chess. And we tried to, do a lot of remote reporting, a lot of digital radiology reporting, a lot of teleradiology reporting from all over the city, not necessarily from Bombay or not necessarily from KEM, but the entire city of Mumbai, especially Dharavi. We had actually built portable X-ray machines, digital portable X-ray machines on vans, and the vans used to go deeper into the Dharavi slums and get the pictures transmitted to a central workstation, and then we could interpret whether it was COVID or not COVID. So that's how we tried and segregated a lot of patients of COVID and non-COVID. That was the first time that we had a chance to do something called as teleradiology within the department or remote reporting. And I think the entire department of radiology right now, I don't know whether they see patients, but the turnaround time for all reports was almost 3 days, 4 days. Like Himangini said, the MR waiting is 3 months and 6 months. Similarly, I realized after getting into digital health that turnaround time for CT or X-rays or MRs or ultrasound should be as small as possible, because the person on the other side is the patient, and what Ravi always taught us was look beyond the patient, look what your interpretation can change the outcome of the patient. So I believe that radiology is here to stay, and radiology is going to change the outcome of how you look at each image and how you look at each patient beyond the image. Thank you so much. I wouldn't take a long time. Yeah, I don't know how many of you know that KEM Radiology has a patent.
We have heard, but please tell us.
We have heard. Okay. I think Kranti should sit here. Hmm? Beside me. Okay. So, this was a pair in radiology. This was a pair in radiology. Okay, long and short, whatever. So, so we used to do procedures together. Okay, sometimes I used to wash up, sometimes he used to wash up. Sometimes I used to stand behind him, sometimes he used to stand behind me. So we always had that rapport in our mind. Means looking at the images, we would say, he knows what the treatment is, I know what the treatment is. We used to ask the resident. So one day, we used to do a lot of mesenteric angina. And you know what happens in mesenteric angina. I had always had the habit of clinically converting the image into the story of the patient. So our residents who are there, almost all residents are posted in interventional radiology all the time. So I used to ask them, iska clinical history kya hai? So most of them would know, most of them wouldn't know. The typical history of mesenteric angina is loss of weight. Not only loss of weight, but significant loss of weight. When I say significant, it means 10 to 15 kg of weight loss, and within a short period of time. So weight loss and mesenteric angina go together, and when we do a DSA or an angiogram, we see that the superior mesenteric artery is narrow at the origin. Etiology is superior mesenteric artery ostial stenosis. Weight loss ho gaya hai. Now, as Ravi has already taught us, what would happen if I treat this patient? I would ask that patient, I would ask the resident, what would happen if I treat this patient now? Because he was now for treatment with a stent, balloon mounted stent. Balloon mounted stent ho gaya, superior mesenteric artery dilate ho gaya. The patient follow-up is important now. The resident was to tell us that the patient will now gain weight. So once we were discussing like this, Kranti also saw, I also saw. So what if you put this stent in a patient with mesenteric angina, the patient will gain weight. What happens if you create mesenteric angina in an obese patient? You should lose weight, right? That was the simple concept. In a patient with obesity, if you induce stenosis of the superior mesenteric artery, what will happen? Mesenteric angina. What will happen? Cytophobia. What will happen? The patient wouldn't eat food. What will happen? He will lose weight. So that was the origin of the idea that we can have a device which constricts a blood vessel. Like you have a stent, you can have a device which regulates the blood flow. So we created a design. We created a stenosis in a artery. So how do you create? So you create a stent which mimics a stenosis, like a hourglass shape. Got it? So you put that in the superior mesenteric artery and the patient should lose weight. So that was the origin of the idea that obesity can be treated by inducing mesenteric angina, controlled mesenteric angina. Then I think you should tell something about it. Then we designed this stent. We sat with a lot of engineers, we sat with a lot of patent attorneys, we sat with them and devised what they call as a big protocol of the entire idea to be written down, documented, and sent it for patent approval. Eventually, after 7 years, we got a US patent. And after 1 more year, we got a European patent. So we have US patent as well as a European patent for a device which would restrict blood flow. Now we have extensions of this. Now nobody wants to treat obesity with our device. So it needs a lot of, device manufacturing. It would require a lot of benchmarking. It would require a lot of things which is beyond our control. So we will repurpose the idea of this device for treating something else. So that will come in the next 1 year. Thank you so much. Thank you.
Thank you, Dr. Deshmukh, sir. Our next address comes from the very heart of our department, its leader. She is not just our HOD, but our guide, mentor, and a steady hand that navigates our ship. Let us all put our hands together to welcome Dr. Hemangini Thakkar ma'am to grace the stage and share her thoughts.
Thank you so much. I'll keep it short. I wanted to thank each and every one of you for coming over here, and I'm sure you enjoyed this as much as we have enjoyed it, preparing it and delivering it. I want to thank first of all Ravi sir for I keep eating his head for everything, starting with making a Google form up to Google link, then checking everybody's articles, spelling mistakes, all the photographs, collecting, and then helping us to make a souvenir. So, sir, thank you so much. Without your help, it wouldn't have been possible. I want to thank Natkani madam for her enthusiasm and her persistence is so unparalleled. Sometimes I feel ashamed. I sometimes wonder, madam, just let it go. No, what is there? But then, no, she always persists. And over a time, I've realized that pays off. So, madam, thank you. Thank you so much for instilling those values in us. I want to thank Suleiman Merchant, sir, for giving us some moral support. Hemangini, whatever you want to do, we are with you. Don't worry. So, thank you, sir, for that. I want to thank HOD Psychiatry, Dr. Ajita, because she had booked this MLT and I just told madam, even we are having this, and so sweetly she just gave in one go, okay, you take MLT and I will go to Lecture Theatre 3. So I am very thankful to her also. And I am thankful to all my pillars of strength, my all SRs. Rashmi, who made all the mementos, so beautiful mementos she has made. When we'll felicitate, you will see that. So that entire thing is curated and designed by Rashmi. So she had made that. And every running around, all my SRs have done. Harshita, Chandranshu, Ajit, and Shire. She is just gone out. So thank you all of you so much. Now just want to make few important announcements. This is anybody wants to donate, this is the QR code. It is the QR code of entire hospital. So when you scan the QR code and if you want to donate, you please write Department of Radiology and your name. Just don't write GSMC Medical College, which comes automatically. Then if somebody doesn't have a QR code, then these are the bank details. You can give a check also, or you can make a NEFT payment also. But don't forget to write your name and for Department of Radiology at the back of the check. Please don't forget that, otherwise that check will remain with the DDF clerk for years together. Anybody who is not able to join this get together but who wants to buy a souvenir, they can always scan the same QR code and they can pay 2,000 rupees for the same. And obviously food and tea, we'll break for tea and coffee, and it's not allowed in the MLT. Thank you.
Hi, there's a Zoom link being made for people who are not attending. Excuse me, can I have everybody's attention? Hello? Arey beso baba, beso. There is a Zoom link being made by the department. Hello, Vimal. Mike. Okay, everybody, Preeti, Vimal. One sec. There is a Zoom link being made by the department for people who have not been able to come or who want to attend. So if anybody knows anybody who's waiting, Tufail was waiting, Munna's waiting somewhere. So please come and ask these people or you can hook them up. The laptop will be kept here and whoever wants to talk to anybody, I hope Tufail will be joining in now and other people. So anybody who wants to talk to them, please come into the laptop and we can hook you all guys up.
Thank you, sir.
We have a 20 minutes tea break now. Tea, coffee and some refreshment snacks are arranged at the Dean's lawn. Please proceed there.
अरे वो
We are trained in that.
ये वाला चल रहा है, ये नहीं चल रहा है।
A warm welcome back to all our radiologists. I hope everyone enjoyed their cup of tea. There is some change in the sequence of events as some of our guests want to leave early.
Guys, let's start the program.
नहीं आगे का चाहिए ये इधर से
नाही जाणार नाही
हाँ बराबर है
शेअरिंग करतो ना स्लाइड कुठे आहे ही 7th ना ठीक आहे
नहीं वो शेयर
नाही झूम बोलो
शेयर नहीं करना
नाही करतो
नहीं करना नहीं वो भी नहीं We'll now proceed with the magazine inauguration. Our journey in the Department of Radiology at KEM has been marked with a lot of memories. And these memories, which shape a legacy as rich as ours, deserves to be captured and printed in ink so that it can inspire the generations to come. It is therefore with immense pride we introduce our own alumni magazine. It is more than just pages conceptualized by our HOD, Dr. Hemangini ma'am, with immense efforts to the smallest of details. It has articles from our esteemed alumni, nostalgic photographs, and highlights of our department. I would now like to invite our esteemed dignitaries, Dara Kuka sir, Ravi sir, and Hemangini ma'am to grace the stage, and Adkarni ma'am to grace the stage for our magazine inauguration. Deshmukh sir and Anil Karapurkar sir, please join in. Sir, can
फोटोग्राफर किधर है?
Virasat is a word which means legacy. It is the story of every scan interpreted and every student who has grown into a master within this institution. Copies of the magazine will be distributed to everyone at the end of the program before leaving the MIT. We hope that you feel nostalgic going through its pages. We will now begin with our felicitation program. Before the program, I would like to ask Himangini ma'am to say a few words.
The main purpose of this event which we have organized is so I would say that our life is all about the choices which we make. The choices which we make consciously or subconsciously, but it always shapes our life and the direction of our journey. Every choice which we make, which reflects our values, what we prioritize and what we are ready to sacrifice. Choices might have been made because it just feels right, or it is out of fear or out of convenience. Whatever it is, but yet each choice carries a quiet power guiding us, our relationships, our opportunities, and even the person which we have become. So these are the people whom we want to express our gratitude by felicitating them. And they made a choice to remain in the public hospital. They made a choice of being a faculty. They made a choice to teach the postgraduate students and use their, for whatever reason, but they remain in the public hospitals. So we want to felicitate all the people who have been faculty in our department. As we have tried to cover everybody, but in case if we have missed out somebody, please forgive us for the same. Thank you. We will start that very fast.
We will begin with our Lifetime Achievement Awards. I would like to ask Dr. Ravi sir to kindly grace the stage. I'd like to ask sir to present the award to Malini Nadkarni ma'am. Ma'am has worked in our department from 1968 to 1979 as a professor. Though Madam has retired from KEM Hospital, the most interesting part is Madam was born in KEM and the umbilical cord is not cut as of yet. The next person to get this award is Dr. Anil Karapurkar sir. Sir has started neurointervention department in our hospital. I would like to ask Ravi sir to kindly present this award to Dr. Anil Karapurkar sir.
The last time I did something like this was in my school. I was giving the bachus in the school. Two नए बच्चे.
Dr. Dara Kukka sir has worked in KM from 1975 to 1985. In spite of doing post-graduation in Canada, sir decided to come to KEM and provide his valuable knowledge and insights. We are grateful to you, sir. Now I would like to ask Dr. Nadkarni ma'am to come on the stage. Sir, you have to wait because the next award is for you. Ravi sir has worked in our department from 1980 to 2010, and he is a person who needs no further introduction.
Why Ravi is here today, please thank me also for that. Because when he had applied, my department used to be full of gynec people. Our department, our department used to be full of gynec people. Because, the radiology posts were given according to final MBBS marks. There was nothing like selection. And hardly 1 or 2% in the department doing radiology, and other posts were filled by gynec people. You can ask some of those old gynec chaps. And when Ravi had applied, I had complained to Dean about it. So Dean said, okay, you come and be present at the time of interview, but I can't change the rules. Rules are rules. So I used to scrutinize every patient, every student, ask them questions, why you want to come here and all that. So when Ravi came, his first choice was orthopedics. His second choice was radiology. All others were gynec. So I said, this fellow will at least look at the x-rays. This is 100. That is why, and I'm very happy that I did that.
Yesterday, I told you all the short story of why I came to radiology. Because an orthopedic resident told me, Ravi, तेरे को कुछ मिलता नहीं ना, तू radiology कर, पूरा time pass है.
Now I'd like to ask, sir, you can take your seat. I'd like to ask Dr. Nadkarni ma'am to present this award to Dr. Kivesera sir. Though sir is not a KEM alumnus, he has been consistently teaching general radiology to all of us residents every Tuesday since a long, long time. We are very grateful to learn from you, sir.
I am very happy to hand over this memento to Dr. Kivesara. Actually, we used to have lectures. He is my classmate. We did radiology together. What happened? Okay, it's all right. So we did radiology. At that time, we used to have lectures in BARC. So every day, every alternate day, we used to have.
The new radiology trainee.
So every alternate day, we used to have lectures in BRC. So I'm very happy that we are, and actually his daughter also is now in radiology. Accidentally, I met her some time back, and I was very happy to know that, radiology, because my father was a radiologist. So the father radiologist, daughter radiologist, it's a good combination. So I'm very happy about him, and he spends a lot of time in teaching. Now must be we are of the same age. And he still goes to Nair, Sion, KEM once a week, every place, and does the teaching. I think that's really creditable.
किधर है?
Now we will start the felicitation of our esteemed faculties. I would like to ask Dara Kuka sir to please come on the stage.
नेक्स्ट किसको कर रहे हैं फेलिसिटेट?
सुलेमान सर को कर दिया तब तक होगा क्या ऊपर?
जिसका कर रहे हैं बोल मैं कर देता हूँ.
नहीं स्टार्ट से करते हैं फिर अभी.
ओके.
I didn't quite hear you.
Sir, you have to present the awards. I will call upon. You have to give them the awards.
नहीं वो ये नहीं है ना ऑन नहीं है.
Dr. Suleiman Merchant sir has worked in KEM from 1981 to 1991. Sir then became the head of Department of Radiology at Sion Hospital and then heading its institution, the institution as its dean.
अरे वो ऊपर अभी वो नहीं होगा तो जब जिसका करना है. हाँ ठीक है चलेगा. ये
भावेश सर का करते हैं.
अच्छा भाई नीचे था एकदम. तो अनाउंस करना.
Dr. Bhavesh Popat sir has worked in KEM from 2009 to 2018. He's a renowned interventional radiologist in Mumbai with his private center in Dadar. I'd like to ask Dr. Palak ma'am to collect the award on his behalf. Dara Kuka sir, you have to present the awards. Okay. Okay. Ravi sir, will you present the, I'd like to ask you to come again. Yes. Dr. Srinivas Desai has worked in our hospital from 1980 to 1984 and is a visiting professor from 1986 to 1988. He's currently the head of department at Jaslok Hospital, Mumbai. Dr. Vimal Someshwar sir has worked in our hospital from 1985 to 1988. Currently, sir is the head of department at Kokila Ben Dhirubai Hospital. Dr. Hemant Deshmukh sir has worked in KEM from 1987 to 2022. Sir has worked as the head of department and then dean of KEM Hospital. He is our COVID hero who managed the hospital during the pandemic. इसके बाद श्रीनिवास सर को skip करना है, फिर प्रीति शाह. Dr. Preeti Shah has worked in KM from 1990 to 1994. At present, Madam is a private practitioner in Mumbai.
Hey, Preeti, keep going. Hey, Preeti, hi. अरे, आवाज आ रहा है क्या?
Zoom में से बोल
अरे, 3 cheers for Preeti.
Dr. Malan Gandhi, ma'am, has worked in KM from 1990 to 1995. She's a renowned radiologist and expert ultrasonologist owning 2 private centers. She's not there. Dr. Bhavin Jankaria, sir, has worked in KM from 1990 to 1991. Sir owns Jankaria Imaging Center and actively takes out time and participates in regular radiology chest medicine meetings in KM every week.
Anyhow, you're taking everything on boys' account.
And his wife was one of the best registrars I had. Bijal is one of the best registrars, guys. ये मैं बैकग्राउंड से इंफॉर्मेशन देते रहता हूँ.
Dr. Uday Limaya, sir, has worked in KM from 1995 to 2014. He's an internationally acclaimed neurointervention radiologist at Leelavati Hospital. Dr. Harshvardhan Shrotri, sir, has worked in KM from 1996 to 2001. He's an intervention radiologist practicing in Pune and is avidly involved in plays and stage performances as an actor and director. Dr. Manish Srivastav, sir, has worked in KM from 1999 to 2009. He's currently a neurointervention radiologist at Kokila Ben Dhirubhai Ambani Hospital. Dr. James Joseph has worked in KM from 1997 to 2000. Dr. Abhijit Raut has worked in KM from 2000 to 2009. He is currently the head of Department of Radiology at HN Reliance Hospital, specializing in neuroimaging and body imaging.
Hey, well done, Abhijit. Yeah, yeah. Yeah, Abhijit got 3 cheers, man. Well done, Abhijit.
Dr. Priya Chudgar, ma'am, has worked in KM from 1997 to 2001. She is currently practicing as a cardiovascular radiologist. Dr. Darshana Sanghvi, ma'am, has worked in KM from 2003 to 2009. She's a renowned radiologist at Kokila Ben Dhirubhai Ambani Hospital, Mumbai. Dr. Vijay Hanchate, sir, has worked in KEM from 2001 to 2004. He's a private practitioner with center in Mulund. Dr. Shlok Lolge, sir, has worked in KEM from 2002 to 2006. He's a fetal medicine specialist in Navi Mumbai. Dr. Sheetal Bangar, ma'am, has worked in KEM from 2009 to 2014. Madam has a private ultrasound center at Dadar. Sir, you can now take your seat. No, I'll not. Let us now begin with the most anticipated part of our evening, the Masti session by Vimal Someshwar sir. I'd like to invite sir on the dais and take over the mic.
This is going to be conducted by Moru, Vimal and myself. Where's Moru? Moru is here. Please. This is on. ये खाली time pass session है. There's a lot of fun to be learned. Radiology maybe, maybe not. But stalwarts of comedy in front of you. Vimal, stand up. Yeah.
So, yeah, I think, how many of you have seen Kapil Sharma show? हाथ ऊपर करो, मैं तो बड़ा fan हूँ. So in Kapil Sharma show, we have that lady who sits there. What's her name? Archana ma'am. So we have our Archana ma'am here. Look at her laughter. Whatever jokes we crack, she has to have the mic in your hand. Okay? तो अपने को भी अच्छा लगेगा ना कोई हंस रहा है. आजा. So friends, yeah. सब लोग भी हंस सकते हैं. But उसके जितना आवाज
के बगैर हंस से दिखाने का उधर से. ये तो माइक पे हंसेंगे आप लोग without mic हंस के दिखाओ.
So basically, I think we learned a lot. KEM Radiology Department, one of the finest radiology department in the country, and we were all lucky to be part of that. But very important that every day that we passed through the corridor, that we were doing procedures, the patient, the way they talked to us, there was always a lot of humor, a lot of masti happening. And it was just that you had to keep your eyes and ears open and you would get those masti. And that is what we're going to discuss today. How we're going to do is we'll start with Hemant Morparia. He will narrate some stories. He's a phenomenal. How many of you know about him? Okay, so one of the finest cartoonists that we have in the country. So Hemant will discuss about or talk about some of the funny events, episodes. Yeah?
It's open for all. Anybody with the funny
And
story.
we may take names also. Nothing to mind. It's just fun. So please don't take it bad. Some people who are here, some people are not there, but maja karo.
So, well, there's so many anecdotes, so many episodes. We were in the neuro department unit, neuro radiology unit, and we were doing a myelogram. So, those days we had not even got image intensification. We had explorators and fluoroscopy, right? So, the thing was that before one could see properly, one had to get one has to wear red goggles. This may be not familiar with the younger lot at all, but we had to wear red goggles so that we would get, our eyesight would get adapted to the night vision or because of the dark room. Yeah. So Baldev Singh Aulak, I called him the Baldev Singh Aulak, Baldy. The only Sikh who has been named Baldy.
Yes.
So he was the senior most guy. He was wearing red goggles. I said, Baldev, Dr. Baldev, let's start the myelogram. So he, no, we have to wait. I'm not adopted. I said, what a coincidence. Even I'm not adopted. We have biological parents. Wonderful. No, I'm not adopted. Let me get adopted. I said, okay. See, puncture ho gaya, the column is there, it's in the lumbar space, patient is horizontal, and we want to see a lesion which is in the thoracic region, so we're doing head low. We are elevating the feet. And the myodil is a viscous liquid. Sometimes you need to assist the movement cephalad. So sometimes you had to tap the patient. So what did I notice? Baldev was tapping the explorator.
साला हिलता नहीं है.
Hilta nahi. And then I quickly checked to see what time it was. It was not 12 o'clock.
So we'll call him again. I'm sure there is enough time to do all this. We'll have Srinivas Desai. He wants to talk to us about some interesting personality, right?
I have to go for a marriage. I'm sorry, that's why I'm rushing. But Vimal said you got to tell this before you go. This is about my very dear friend Ravi. The human aspect of Ravi. We'll tell you those whom you don't know. And I'm telling this. I've taken his permission to tell this. Ravi, I hope you don't mind. The first thing, of course, before I say this, when I became a registrar, the first two housemen of mine were Vishram, and hold your breath, the second guy, Ravi Ramakant. He was my first houseman. And when I entered the department, both of them stood up. I said, I don't show this kind of a pseudo respect. And he took me so seriously, he never respected me again in my entire life. That's sad. Okay. So there was a party at my place on 31st. I had called all my friends. And I called Ravi. I don't know what struck me. And I just called Ravi. And I never expected Ravi would come to my place. And this party starts around 8:39, and everybody's nicely salted, and there comes a bell, and we see 11 o'clock, Ravi comes inside. That was surprise, big surprise to all of us. And then you know how it is, the gang, which is already one or two, they're like, Sukhi was there, Jaggi was there, Seema, Tushar, Pramod, everybody was there. They just tried to pounce on him. He said, Ravi, actually, after pila padega. So he got scared. He said, Srinya, I only trust you. You give me the drink. I don't trust anyone of them.
What a decision.
He has been always making the wrong decisions in the life. So I went to the bar, picked up, he wanted limca. I poured a limca and gave it. When I poured, then I said, yaar, 31st December को रात को किसी को खाली लिमका दे, इससे बड़ा पाप तो हो ही नहीं सकता. मैं तो रो नरक में जाऊंगा. आज नहीं जाने वाला है और जाता है. तो थोड़ा उसमें मैंने होड़का डाल दिया और दे दिया उसको. And I forgot. And then music was going and everything. We all forgot. I also forgot him. After half an hour, Ravi says, Shinya, give me that limca, yaar.
That was oral contrast for him.
So thanks for that. Okay.
Ravi ka just bit. Preeti is here. She'll be witness. There's only one party Ravi attended in blue jeans. किसी को मालूम नहीं. I was trying to get the picture from Preeti. नहीं हुआ. You found the jeans.
We are talking of jeans that you wear, not the gene. G any नहीं मांगता हमको.
Baldev Aulak का बात चल रहा है, so I must share this. How many of his classmates are here? Nobody, right? So I want to verify this information. I don't know if it's true. It is learned that Baldev, the quietest of guys, the gentlest of guys, the timidest of guys, he was sitting in a class with Shiri Sheth, the gynecologist from KEM, who was bald with 2 strands of hair on his head. We all remember that. So apparently the fan blew a bit and his hair strand came in front of his nose. So Baldev of all people quietly went, put it back and sat again. अभी ये सच है कि नहीं बलदेव बता सकता है.
So when we are on Baldev, let us continue on Baldev again. So this was Sunday duty. I'm sure in KEM we all did Sunday duty and we had to take X-rays and all. So there's this pharmac department. They were doing some experimental work and they must have given some oral radiopaque material to the mice, two of them. And they came in Sunday कि हमको देखना ये oral किधर गया है करके. So they came to the department and Baldev was on duty and I was the houseman. So these guys came on two plate with two unconscious mice over there and they said, iska X-ray lo na. So typical Baldev, very sincere, very straightforward, most sincere guy. He kept the two mice on the table, collimated the whole thing, focused everything, and then he went on to the console. Saas ban, saas ban, saas. So that was Baldev for us. So another thing, this was something which my patient got this to me. Young interventional radiologists, we are all interested in doing new things and whatnot. And there is this waiter who used to work at Muhammad Ali Road. How many of you know Muhammad Ali Road? Big, fat, broad road, 6, 8 lanes, both the sides, and a huge road. So he used to work at one of the dhabas over there. And he came to me, and one of those happy and fancy guy. So I just asked him, Ravi would always tell us, pura clinical history chahiye, huh? So ठीक है, क्या तकलीफ है तुमको? अरे डॉक्टर साहब क्या बताऊं आपको? पहले जब पेशाब करता था ना, तो 3 फीट तक अपना दीवार को गिला करता था. बोला अरे वाह, अभी क्या हुआ? साहब क्या करूं? अभी पेशाब करता हूं तो पैर पे ही गिरता है. तो मैं बोला अच्छा. I knew the history. What was the diagnosis? Anybody? Stricture urethra, right? 35-year-old man, stricture urethra. So I just asked him, बाहर जाता था क्या? Typical history KEM में बाहर जाता था क्या? हाँ साहब, ग्रांट रोड पास में ही था तो मन होता था तो जाता था. So the diagnosis was one of those STD causing bulbomembranous stricture urethra. Thanks to Suli, you have taught us all this.
What exactly?
What? So I said, now I was explaining him the procedure and I said, so I said, we have to do urethrogram. So I had to explain the whole procedure to him. Now, there are certain words you cannot use freely in a medical science. So now what to say? So I said, देखो, हम लोग है ना, आपका नली पकड़ेगा, एक सिरिंज में दवा देगा और दवा देके हम इंजेक्ट करेगा तो मालूम पड़ेगा कहाँ पर तुम्हारा नली सिकुड़ गया है. So he was ready. We did the procedure and I did the urethrogram, retrograde urethrophy, and a good picture, nice tight stricture. So I told him, देखो, ये तुम्हारा नली पतला हो गया है, इसको हम खोल सकते हैं. हम लोग इंटरवेंशनल वाले, हम तो एंजियोप्लास्टी में एक्सपर्ट है. He said, साहब खोल दो. I put a wire and took a balloon and did a balloon plasty. Sir, we've done angioplasties thanks to you. I did a urethroplasty then. And the pictures were fantastic. Post-plasty, the stricture had dilated. Now the urethra was about 6-7 millimeters wide. The narrowing had gone and I was happy. And I said, let me just go and, just do some deadly work to show him. So I took both the x-rays, the pre and the post. And I took both the x-rays and I showed him, देखो, तुम्हारा जो नली है ना, इधर एकदम पतला हो गया था. अभी हमने फुगा डाल के खोला है, देखो पूरा खुल गया. So this man tells me, साहब, आपके हाथ में तो क्या कला है. आपने गली को मोहम्मद अली बना दिया.
So you have anything? No, so this also continuing in the same vein or same urethra. I'm doing a retrograde and antigrade urethrogram, cystourethrogram. So while cannulating the bladder through the with a catheter, I find that this patient, who also happens to be same community as Baldev Aulak, but so This man was, normally you have patients wincing and uncomfortable. This man was giggling. What? I said, what is happening? So I am putting the catheter inside. He's giggling, giggling. Then he's actually laughing. I said, I couldn't. I said, क्या हो रहा है? सरदार जी आप हंस रहे हैं? किस बात पे हंस रहे हैं? डॉक्टर साहब, मुझे लगता था अब तक यही किसी में घुसता है, इसमें भी कुछ घुसता है. पहली बार देखा.
So on urethra, Ravi just reminded me, and this is extremely funny, or I don't know how to put it. Must have been very major distress for the patient, but so we were doing this urethrogram, and I was not doing. Another colleague of ours, a lot of you know him very well. Now, suddenly, Saturday meeting, all of us are sitting, and our technician, Mr. Salvi, how many of you remember him? Unfortunately, he's no more. So, Salvi comes, a very naughty character, absolutely naughty character. So, Salvi comes and shows us one urethrogram. And believe me, that urethrogram had the whole urethra extending across the hypotenuse of 10 by 12 cassette. So you know how long it was. So all of us were surprised. ये क्या है? किसका है? So we were asking him, क्या है? Doctor साहब, sir, उधर देखो, उधर क्या चल रहा है? So this colleague of ours was doing a urethrogram. And this colleague was very sensitive to radiation falling on his hand, on his fingers. So, patient was positioned and he was holding the urethra, the penis, and about to inject, but the collimation light was falling on his nail. So he pulled it a little. Now Salvi saw it and he said, "ये तो साला पूरा urethra आता ही नहीं है, थोड़ा collimation खोला." This guy pulled it again. He opened it again. He pulled it again. He opened it again. And by the time the urethra was here and the band was, ah! So this is what happens sometimes in this our situation. Any more?
This is where amongst the first cartoons of Murpare come in. Another resident, abhi nahi hai. So Salvi same situation. खींचेगा बाहर. So I said एक दिन ये रूम के बाहर से DRU करने वाला है. तो I asked Moru to draw. He drew the cartoon. It was on the uroradiology door, if you guys remember, for years to come. That was one of the first cartoons. And while on DRUs, there's this nice story about a cute couple we had as residents. One was Mona Darling, and the other one was 1 year senior, Dinesh Bhai. Both very sweet guys. But whenever I reported DRUs, I used to always know which one Mona had done, which one Dinesh had done. It was very simple for me, so I used to always pull their leg and say, Mona, tu ne kiya hai. So it was, usual batter. Then one day I said, "Nahi, maine nahi kiya. This is Dinesh's." I said, "Dinesh ka kya hua?" Then, "Sir, that guy took a fancy for Dinesh."
Any more? I had a couple of guys in the audience who wanted to say also something.
Jawar wanted to.
Jawar kidhar gaya?
Jawar had something to narrate. Shivde, you want, sir? Deepak hai. अरे आओ एक एक करके आओ ना सबके.
आओ आ जाओ.
A small thing. I think, Ravi, you don't know about this. Meher is not here, right? Yeah, Meher knows about it. I was a junior resident in neuro, one of my first times for myelogram. And we had that oil-based dye, and we just shifted to a water-based dye. I was junior में बोला LP करना और संभाल के रखना. ये दोनों ये और बाजू में local same दिखते हैं. बोला अच्छा है, ठीक है, करते हैं. We did a local LP किया, मस्त. This is the best compliment that I've ever heard in my life. अंदर डाला local, and I didn't know. Patient, we used to make it straight for LP. और you have to take AP lateral oblique. Suddenly करके click मारा, अंदर कैसेट गया, खाली. Second click मारा, देखा तो head. Third गया, है किधर? Patient किधर है? I put the hand there, patient not there. Patient किधर है? मुझे बोला लाइट चालू करो, क्या हो गया? लाइट चला था, पेशेंट लाइंग ऑन द फ्लोर। बोला क्या हो गया? इस पे खड़ा था, नीचे कैसे गिर गया? कुछ नहीं है, कुछ नहीं है। बोला कुछ नहीं है क्या? कुछ नहीं है तो नीचे कैसे गिरा? इधर नीचे कुछ नहीं है। बोले नीचे कुछ नहीं है रे, हमको कुछ मालूम ही नहीं क्या हो रहा है। दिस वाज समथिंग रॉन्ग। और मैं वो वायलिनिस्ट सबको खड़ा किया, बोला मेड हिम सेट अप, मैंने लाइन बोला यहाँ से नीचे मुझे कुछ समझता नहीं है। देन वी सॉ द ट्रे, फैंटास्टिक, दैट लिग्नोकेन सिरिंज वाज जस्ट इन दैट, सबकी फटी, एवरीवन ही कॉल द एनेस्थेटिस्ट, कुछ नहीं करने का, पेशेंट शुड नॉट लाई डाउन एट ऑल। खड़ा किया, उसको वार्ड में लेके गया, एंड आई वाज द जूनियर मोस्ट ना, पेशेंट को इधर बिठाया, सामने मुझे बिठाया। You have to see that it doesn't move inch this way or 1 inch that way. Till the effect goes, he has to sit straight. This was all fine. I was shit scared, and there's tremendous tension, and I was sitting like this. Then everybody slowly went away. Then I and the patient, सामने बैठा था. And after some time, patient tells me, साहब इतना टेंशन में क्यों हैं आप? मैं बोला यार जाने दे, तुझे नहीं समझे, तू स्ट्रेट बैठ, तू हिल मत, तू स्ट्रेट बैठ, तू हिल मत, बात मत कर, बात भी नहीं करने का, सीधा बैठ, हिलने का नहीं। मैं आपको बोलता हूं, मुझे लगता है कि आप सबसे जूनियर डॉक्टर हैं, बट आपके पास पहले आना चाहिए था। बोला क्यों? इधर से इधर मुझे पैर में दर्द होता है, 3 साल से सब ऑर्थोपेडिक सर्जन के पास जाता हूं, किसी ने दर्द कम नहीं किया। आज आपने इंजेक्शन मारा, तब से ऊपर से नीचे दर्द ही नहीं है। इतना अच्छा कभी नहीं हुआ। बेस्ट कॉम्प्लीमेंट।
शिवड़े सर,
यूरो रेडियोलॉजी सेशन था, मेरे साथ में योजना और माया काम करती थी, और यूरेथ्रोग्राम मिक्सुरेटिंग सिस्टो यूरेथ्रोग्राम करने का था, बच्चा था। सो साल्वी आया, ऐसा साल्वी का स्टाइल था, और हाँ ऐसा आया। फिर वो रात के टाइम ना उसका ऑर्केस्ट्रा का ये था, वो ऑर्केस्ट्रा में गाना वगैरह गाता था, ढोलक बजाता था, तो गाना भी गाता था। लेकिन कभी कभी वो क्या करता था, उसको कुछ करने का रहेगा ना तो रूम लॉक कर देता था यूरेथ्रोग्राम, क्योंकि रवि ना आए, सुलेमान सर ना आए, कोई अपने को नहीं देखे। तो एक तो बच्चा था, तो उसका उसने पैंट खोला। पैंट खोलने के बाद तुरंत ही माया और योजना, वो लेड कर्टन था, उसके पीछे भागी, शी शेम। हाँ साली बोलते है, मैडम लोग क्यों डर रहे तुम, आओ ना सामने, आओ ना, देखो। फिर भी बच्चा है ना, उसको फिर कैथेटर डाला, इंजेक्ट किया, ब्लैडर फुल किया। फिर हम लोग बोल रहे थे सुकर है, वो बच्चा करने को तैयार ही नहीं था, वो सुई नहीं कर रहा था। फिर वो सालवी बोलता है तुम चुप बैठो। फिर वापस उसने लॉक देखा, सुलेमान सर नहीं आ रहे, रवि भी नहीं है, वाह। तो बोले मैं गाना गाता है। उसने चालू किया। वो कल रात को उसने, वो टाइम दादा कुंडकी का फेमस गाना था, ढगाला लागली कळ आणि पाणी थेंब थेंब गळ, ढगाला लागली कळ पाणी थेंब थेंब गळ, and that बच्चू started passing urine।
तानसेन का जैसा हो गया। तानसेन गाना गा तो बारिश आया था ना।
I have one more incident. Dr. Ravi in 1985 told me that Shivde, you go to Mirrors and get one ultrasound machine. There is lying one ultrasound. हमारा जी का मशीन खराब हो गया था, वो सोनो लाइन कुछ 30 या 50 था सोनो लाइन, उधर it was lying there. He gave me sheet and phone numbers. तो मैं अपना लालपरी एसटी से गया मिरर्स, और शाम को पहुंचा मैं उधर। तो उधर हॉस्पिटल में गया, मशीन कलेक्ट किया, उन्होंने पैक करके रखा था। बोले अभी कुछ ट्रांसपोर्ट नहीं है इधर। मिरज के वो बाजू में नर्सिंग होम था, तो बोले क्या नहीं अभी ट्रांसपोर्ट नहीं तो कैसे लिखेगा, कोई टेम्पो रहेगा कुछ रहेगा। नहीं नहीं इधर कुछ नहीं है अभी, अभी सिर्फ बैलगाड़ी है। तो मेरे स्टेशन तक वो बोले तुमको बैलगाड़ी लेके जाना पड़ेगा। तो वो बैलगाड़ी वाला गाड़ीवान दिया, मेरे को मशीन दिया और मैं वो बैलगाड़ी में मशीन डाला और मैं मशीन के साथ बैठा, हाथ में पकड़ के बैठा, वो बैलगाड़ी से कुड़ुक 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 करते थे ऐसा ऊपर नीचे ऊपर नीचे। मैं बोला साला मशीन को कुछ हो गया तो रवि मेरे को नहीं छोड़ेगा। और फिर वो मशीन फिर मैं स्टैंड पे लेके गया, उधर एसटी बस खड़ा था मुंबई आने वाला। तो फिर हमारे बोला कि इतना पैसा लगेगा, ऊपर चढ़ाना पड़ेगा। कंडक्टर बोला अंदर नहीं रखेगा। मैं बोला बारिश बीरिश कुछ होगा तो वो मशीन खराब होगा, अल्ट्रासाउंड का कॉस्टली मशीन रहता है। फिर मैं उनके साथ में ऊपर गया, पैक किया, उसके ऊपर ताड़पत्री डाला और फिर मैं बम्बई आया। मुंबई आया तो मेरे को स्टैंड इधर ऑक्ट्रा नाके पे पकड़ा, बोले कि नहीं नहीं ये इसका तो ऑक्ट्रा बनना पड़ेगा। अरे मैं तो बोला पेपर्स है सब, रवि ने वो सब दिया था पेपर्स। और फिर नहीं नहीं मेरे को 2 घंटा ऐसे ही अटकाया। तो फिर मैं उसके भाव छोड़ देना अपना कारपोरेशन का है, वैसा पैसा नहीं है मेरे पास, कुछ नहीं है। फिर बोला अरे मैं तो कारपोरेशन में काम है। बोले तो किधर का है? अरे नासिक का है। अरे मेरा तो गाँव है। तो मैं उसको पटाया, फिर मशीन लेके आया, लेकिन वो बोले गाड़ी उधर बॉम्बे सेंट्रल लेके जाएगा। फिर बॉम्बे सेंट्रल लेके गया वो गाड़ी और फिर उधर से मैं टैक्सी के ऊपर रखा और फिर लेके आया। सुबह सुबह मैं सुबह पहुंचा, बोला इसका मशीन का कुछ हो गया रहेगा ना तो रवि मेरे को नहीं छोड़ेगा। फिर मैं सुबह से आया 6:30-7 बजे। पहले वो 53 के बाजू में अपना अल्ट्रासाउंड था, उधर जाके मशीन चालू किया, उसका सेक्टर प्रोब था, गुल ऐसा चलता था वो, मोटरलाइज सेक्टर प्रोब था, मैकेनिकल सेक्टर प्रोब था। ये चालू हो गया। फिर रवि को मैं बोला अरे मैं मशीन लेके आया ऐसा। पहली बार मेरे को रवि ने शाबाश की दिया।
But he deserved the shabashi for all the effort that was made. And remember, since then, ultrasound department has flourished. He is also flourished, by the way. He's a brilliant ultrasonologist in Nasik. I'll have Jawahar to come in, please.
Continuing from where Shivdi left, I think Salvi had even more innovative ways of inducing urination. See, his favorite, means I had coined this word, he gave this Nataraj pose to all the male patients for MCU. And he used to close the door, as you said, and all the female residents used to be out. And one more technique too in his armamentarium was, he used to fill one 50cc syringe with cold water. And then from far he used to inject
Pichkari.
on the pubic region. And that used to induce even the most refractory patient used to pass urine. So that was one. And the second experience which I want to relate was with a registrar of mine who was Anirudh Badde, or Baddy we used to call him. So one night, as Ravi had said, carotid angios were the most common emergencies which we as residents used to do. So one night at, I would say early morning, 2 a.m. there was a call for carotid angio. Baddy and I came to the skull table. We used to do the carotid angios on the first floor skull table. Now that I don't know how many of you have seen the skull table. I think it's a museum piece. So it had graduations in all directions, so you could give whatever angulations you wanted to give to the head. Now the registrar's job was to puncture the carotid and then hand over the injection part to the houseman. So I was the houseman and he had punctured the carotid. And I started injecting, and the registrar's job was to take the sequential shoots. And Mahadev used to unwillingly pull out the cassettes, grumbling as always. काय झालंय, काय करायचंय आपल्याला इकडे. तर like that attitude he had in the middle of the night. And after 2-3 shoots, Baddy comes and tells me, अरे जवाहर कुछ contrast आया ही नहीं है. God knows what is happening. तो मैं बोला देख एक बार मैं वापस एक बार हम लोग शूट लेते हैं, फिर मैं भी आता हूँ तेरे पीछे. तो he took the cassettes and went. I slowly went after him, and what did I see? The lights were on, and he was developing and seeing it like this. मैं बोला
डार्क रूम का फायदा ही नहीं.
डार्क रूम का फायदा ही नहीं. रेड लाइट वाज ऑन एंड इन द बल्ब वाज आल्सो गोइंग ऑन. दैट वाज एट 2 AM इन द मॉर्निंग. आई कुड अंडरस्टैंड. तो मैं चुपचाप वो लाइट बंद किया, तो बैडी देखा मेरे पे. ही हैड ऑल दैट curly hair on his face and he gave me a smile. Shucks man, what did I do? मैं बोला देख एक लास्ट शूट लेते हैं और फिर सोने को जाते हैं, बस बंद कर.
Any more? I think Harshu, you had a small one. मोरू का है कुछ?
Nothing much.
बोल तब तक आने दे.
No, just a matter because he is grammatically very accurate. So one thing where I remembered Ravi was when a patient taught me something. He again from the same community, which I.
Good liking है कुछ.
क्या मालूम?
Point भी है नहीं.
I don't know. So I said he came for a sono. So I said shoes निकालिए यहाँ पे सो जाइए. Saying Doctor Saab, yes. Can I ask you something? I say yeah, sure, please. Doctor Saab, सोना है कि लेटना है? I said, yeah, boss.
फर्क है.
लेटना है. मैं sleep apnea study नहीं कर रहा हूँ. I said, you are very right. So, again, lessons can come from here. सोना. Now I am very careful. सोना नहीं है, लेटना है.
Harshu. Youngsters, you never had any fun or anything in the department? I'm sure there was, yeah? One or two of you?
I can give you one incident.
Once a minute. Tufel, I think Harshu, you do one. Okay. Then Tufel will do it, and then we'll have one or two from the youngsters before we go.
No, let him speak.
Tufel, you do it.
Tufel, go on,
Your
Tufel.
time, yeah.
No, Harshu. Let Harshu go.
पहले आप.
Yeah, Tufel, you do it.
पहले आपको तो गाड़ी छुट्टियाँ थी यार.
Come, Tufel.
Anyway, so hi guys, sorry I've not been with you. I apologize. I had some personal reason I couldn't come. So I have a few things which I remember very well. I came from JJ, so it was a shock to KEM. I used to have a long hair when I entered, and I met Ravi sir, who was quite different, and it took me a little bit of time to adjust to KEM, and took Ravi a lot of time to adjust to me. There was a lot of incidents. There was one incident I remember. I'll speak in Hindi, okay? Easier. So, मैं Girish Fatafekar और मोनाली, we were in the same batch. और मैं IVU कर रहा था. जैसे IVU का story चल रहा था, तो that was one of the nicest place to work. IVU कर रहा था. और मोनाली को तो ऐसे I don't know how many of you remember Monali. She was an amazing girl. But she used to be the most well-dressed girl in the department. Like, always well-dressed.
Connection gaya?
I'll tell you, hold on.
Tufel, the connection is not.
So I was doing the bhatakte IV के अंदर आ गई. Alright, okay. Let me find a better signal. Let Girish go. Hi, can you hear me?
Yeah, it's kind of breaking in between, yeah, so.
Oh, I'm so sorry.
Yeah.
So I was saying कि गिरीश और मैं था, मोनाली मैं DRU कर रहा था, यंग गाय में, और मोनाली अपनी भटकती हुई आत्मा की इसी रूम में आ गई, और the guy had an immediate reaction. Okay, so the problem was अभी इसको catheterize कैसे करूँ मैं? तो catheterize तो कर नहीं सकता, और मोनाली रूम के अंदर आ गई, और मोनाली realized कि अभी बाहर भी नहीं रह सकती है, अंदर भी she'd already entered the room. The guy was a bit भी नहीं कर सकता हूँ, मोनाली अंदर रूम में अटक गई है, और बाहर भी नहीं रह सकती है. गिरीश और मैं तो I couldn't help. So we were like, मोनाली देख तूने क्या कर दिया इस बेचारे का, अभी तू ही इसका DRU कर ले.
Breaking.
The problem was now, the guy, I think the signal is too bad. I'm in the farm, somewhere. Hi. Did you all get what I was saying?
Tufail, I think we'll call you back when you have a better network. Harsh is starting now.
The signal is too bad.
Okay. So this was when Ravi sir used to be when Ravi sir used to be the terror embodied deity of radiology, and we all used to fear him a lot. And many people would remember that Sheila Sheth had come from UK and she was there with us for 1 month, and she had some magic wand, and after she went, then sir suddenly changed and he became very soft after that. So this was the time when he was a terror, and this incident was narrated to me, and that person is here, Sriram Rane. Is he there? Yeah, he's there. So sir used to call from various places in the department to anybody, and the intercom system was there. So he used to say, "I'm Ravi here, and Bachu is waiting outside IVU or whatever." And why is Bachu waiting? Why is Bachu waiting out there? So and people were scared. Like, ye call kabhi bhi aa sakta hai. So Rani decided to play a prank once, and he called up IVU and he said, "I'm Ravi here. And why is Bachu waiting out?" And there was nobody in the IVU, so nobody responded. So he called up number 10. "Hello, I'm Ravi here. Why is the Bachu waiting outside?" And Ravi sir had picked up the phone. And he did not react. He gave the phone to the person who was reporting, phone 5. And then Rani realized it, and he was hiding from sir for next 3 days.
I still fear actually. When Bachu cries, I still fear.
And the dreaded call in 53 was triple vessel angio, GI bleed in the night, and the puck was the machine was on its deathbed, and
Harshul, let them, some youngsters may not know what is a puck changer, so if you can just explain that. Yeah.
Now you see DSA. So in DSA you have everything coming on the screen and everything is digitally recorded. But earlier we used to have films, and the films were serially pushed in a film changer, and you would have a record at what intervals the films are pushed and at what intervals the films are exposed. So maybe the SMA protocol or iotogram protocol, we have had them punched on a paper, and the paper would run in the machine. This was old computer system, by the way. So the films would be exposed like first second, third second, fourth second, wait, 5th second, 6th second, wait, and delayed. So 5, 6 films for iotogram protocol, something like that. So for SMA protocol or for celiac protocol or for IMA protocol, typically you would have 7 to 12 films, and people used to keep it changing also. So 1 run and 12 films to develop, and the junior most resident would do that. So that was the dreaded angio in the night. Fortunately, puck was on its death. So, and we had a machine which was on trial, which sir had got from Alpha X-ray, and this Alpha X-ray people had put up that machine for trial, and they were making it. That was the first probably Indian DSA made here, and that machine had some facility. So we were happy. And my thesis was non-variceal GI bleed. And we received a call at something like 7, 8 o'clock in the night. And I was happy, GI bleed. So we injected in SMA. And there was a huge extravasation, black blob of contrast. I said, what is this? What is this? And I said, the patient is going to die on the table if this is the situation. What is this? Is it going in the aorta? Is it aortic aneurysm? Is it connecting this, that, fistula? And I said, sir would say, this is the case of the decade. I said, we have to treat this, whatever it is, we have to treat this now. And then second injection, more selective, and no extravasation of contrast. Third injection, subselective, no extravasation of contrast. And then we came back in SMA, main SMA. Again we injected, no extravasation of contrast. I said, what is this going on? Fortunately, this machine could save up to 5 runs that time. And it was automatically saving 5 runs. So we went back to the first run and we reran it. We replayed it. And we saw the huge extravasation of contrast, and there were small bones. I said, teratoma, what is this? Case of the century? What is this? What is this bleeding? And then there was a small tail, and there were 4 legs, and which ran off. So this fellow, this Mickey Mouse, used to always visit us at 7 o'clock in the evening when we were doing angio. It used to run on the rails on the machine which was not being used, and it used to look down upon us like this. And that day it ran across the X-ray tube and we saw that extra session.
So, youngsters, come on.
Can you hear me now? Can you hear me, Vimal?
Yeah, we can. Tufel.
Oh, good. Yeah, okay. So, thank you. Sorry, this is better. So, I've got a few things I remember very well.
We want only
one incident was, so we had a group called Monica, me and Girish had joined together, okay? And we were doing an IVU. I was doing a DRU, and Girish was in the room. And, where we used to out next to number 10. And we used to have Monali, she was the most well-dressed girl in our group, and she was always well-dressed, pretty girl. We used to go there. And I was doing this DRU in a young guy, okay? And it was all going okay. I was about to catheterize, and suddenly Monali enters the room. And the Monali enters the room to just chat, right, as usual, and she just entered, and the job was done, finished. I couldn't catheterize this guy. The guy had a hard on, and she was like, and it was so embarrassing. And then obviously everybody realized, Girish was having a laugh, and now what do? And now we're stuck with this guy, I can't catheterize him. And I said, Monali, look, what have you done? And the guy was very embarrassed. And eventually we had to I remember there's nothing you could do, and the guy couldn't catheterize. And then we had to get Monali run out of the room, like literally dash out of the room so that we can carry on with the DRU. And I think I've left that incident, and every time I meet Monali, I remind her of that incident. And I thought that was really funny how it's one of those incidents that always stuck in my mind. And obviously, if Ravi would have come to know, he would have said, why is Monali roaming around, tell her to go and do some work. And we were very strict. But we four of us were very good. And that was one of the incidents I remember in DRU. I'll stop there.
Anybody last? One more? Anybody? Youngsters? We want somebody from... Enough? We have enough time? Yeah, but he's one of the decent guys, spelling it out loud is not easy. So anybody?
Are you talking about me, Vimal?
Yeah, you're a nice, decent guy.
Very decent guy. You need to tell.
Ravi, Terego, you want to say something? Yeah. Udhar hi baithna. Come. You want to, with all the expressions and everything.
There's enough time. Come on.
I think this is sometime in early 90s. 4 or 5 of us, including Vimal, Jaggi, are off to a national conference in Coimbatore. Coimbatore is all madrasi full. Only I am the guy who's understanding everything. These guys have only one occupation. Daru pine ka raat ko. Full time. And they'll drag me along. Jara dekh le kuch hua na, to hum log ko dekh le. So that I've been doing for 25 years now. So that night, Jaggi, Vimal and somebody else, I forget. Deshi, professor.
4 of us.
Are sitting in a bar we went for dinner and they are having beer, only beer. Kuch nahi hoega, only beer. So that guy said, we have a brand called Kalyani. So this guy brings a little bit, both weak hai. Dusra kuch hai kya? Sir, Kalyani double strength hai. Kalyani double strength. 1 bottle, 2 bottle, 3 bottle, God knows what. And luckily, I was sharing the room with Vimal that night. All night, Vimal was
vomiting.
Bluxing. Full time we were doing bluxing. From that day, I call him Dr. Refluxing. And Kalyani double strength, everybody knows. Even in my family, my brothers, sabko malum hai Kalyani double strength.
What is that? Kalyani double strength?
It's a strong beer, very strong beer. So normal beer is about 5% or something. Kalyani Black is good 10 plus. And
I missed it.
yeah. And we were like, after that, I've never had that kind of food.
The other thing I wanted to say was about a teacher of ours, a very respected vascular radiologist who knew nothing of any other radiology. So one night we were doing a carotid angiogram. I mean, the usual stuff, middle of the night to rule out venous sinus thrombosis. So some registrar was doing something. I was looking at the films on the view box, the wet films, and unfortunately he passed away for whatever unfortunate reason. So he walks in and he says, "Ravi, kai chal raha hai?" Sir, we are doing an angiogram. What for? Sir, for to see if the sinuses are normal or not. What do you see? Sir, the sinuses are hazy. हाँ मला वाटलं तर maxillary sinus बरोबर नाही.
So on the same front, Ravi.
Who was with me at that time? No one. I was too old at that time. Anyway, maxillary sinus discernment.
But
another thing, same doctor. Wait a minute. Same doctor. Okay, I'm the supervisor for the examiner for MD final. Dr. Kelkar is the chief examiner. And then unfortunately he doesn't know too much of radiology. He was very good in vascular work. And then he was asking a Bachu student, so I'm pre-MD and this is MD exam going on. And so Dr. Kelkar ventured into a territory he knows nothing about, radiology. So he's telling the Bachu, tell me how you do a myelogram. So that Bachu is telling properly, inject in the needle dalega, inject in the subarachnoid space. What? Inject in the subarachnoid space? He got after him, duk. After the case was over, sir, it is always injected in the subarachnoid space. Of course I know. I was just testing the student.
So on the same front.
Welcome to the late entrants, our LNT, Lachutagani and KD.
Oh, okay, they are there. Oh, wow. So this was the neurology department would attend our neuroradiology meeting, and those days carotid angiogram was a big thing. Myelograms, carotid angiogram. We didn't have CTs and MRs and all those. So lectures are going on. So one of them got interested, senior neurologist, and he said, "Ravi, why didn't you take lectures for us on neuroradiology?" So Ravi said, "Okay," and he was taking a series. First he started with arterial, what are the branches and where it goes and whatnot. And at that particular point, one evening, I'm walking into all the neurologists sitting there. Ravi in the center, talking about venous sinuses. And he's seeing this is a straight sinus and this is a transverse sinus. So he's talking about all the various sinuses draining this way and that way and that way. Every sinus, venous sinus going this way. This neurologist from behind. But Ravi, where does the frontal sinus drain? Ravi को भी मालूम नहीं क्या है किधर से आ गया. Frontal sinus किधर drain?
Same in the same neuro meet. I remember. Baba. This was Sunawala, I remember.
अपना ये था.
Yeah, when he went to. So I remember Sora Baba asking, "Ravi, what is that tense structure just on top of the cervical spine?" That's the skull. Anyway, we did these vertebral angios and it would be like, I think, how many films, vertebral angiograms? 200. So it was left to the very...
Spinal angio you're talking about.
Spinal angio. So there would be like maybe 120 films or something like that, and we had to... Young people here don't know how bad it was for the juniors, the housemen, that we had to individually physically cut with a cutter, one on 4 sides, 3, 4, and
so these
label
are
and
14 by 14.
14 by 14.
No.
These were just cut. Yeah.
No, these films are 14 by 14 collimated. The images would come a straight line. But Ravi wanted them nice and clean. You cut on 4 sides.
And nicely labeled with a marking pencil. So then I was with a fellow called Kulkarni, and we are like doing this endlessly with the kata. For 2-3 hours, I said, Kulkarni, हम लोग इतना पढ़ेला है, अपन अच्छी कॉलेज में आएला है, हम लोग क्या कर रहे हैं? So this Kulkarni had a way of speaking. He said, मोरफड़िया, जब नसीब में लिखा है लोखंड, तो क्या खाएगा श्रीखंड? Incidentally, this fellow also told me one more thing. I said, कुलकर्णी तेरा इतना दोस्त नहीं है, क्यों ऐसा? एक और कहावत है, सोनार शिंपी कुलकर्णी अप्पा, याची संगत करू नये बप्पा.
Come. So I know the terror of Saturday meetings. So I passed from MJ Medical College. मैं टिपिकल मुन्ना भाई जैसे ही था. तो फर्स्ट सैटरडे मीटिंग सर एंड ऑल, तो सीनियर ने पहले इंस्ट्रक्ट किया था कोने का सीट लेने का. सो आई सिंपली गया, कोने में बैठ गया. सर के रवि सर बोला, जूनियर मोस्ट गाय कम फर्स्ट. सर एक एक्सरे लगाया एंकल का, एपी लैटरल. सर आस्क्ड, लैटरल पे सबसे बिग बोन कौन सा है? आई सेड सर कैल्किनियम. टेल मी द एम्ब्रियोलॉजी. बोला यार रेडियोलॉजी में आया यार, ये चीज भी होता है क्या? So that was one fun. Lot of things are there, but I think we are short of time. Priya is there.
We decided to maintain the averages in gender.
Perfect. This show is organized and managed by the women empowerment.
So I have a funny story about Sir. I was a first year resident and we were like Harshu said, we were all so scared of Sir. We used to hide away. We used to hope he would never notice us. So one day I was in number 10 and he was outside and he came in and he's like, Priya, why is this bachu outside as usual? And I didn't care that he was angry with me. I was just so happy that he knew my name. So I went and told the whole department that Sir knows my name, Sir knows who I am, Sir knows my name. So it spread everywhere. Whole department knew that, oh, Sir knows Priya's name. Somehow Sir also came to know this. And in typical Sir style, he burst my bubble. Half the girls in this department are called Priya. So we were 4 Priyas in the department at that. Like Priya joined later, but at that time we were 3 Priyas and then there were 4 Priyas in the department at that time.
In our days, in conferences where they are, as usual, PG students used to get concession. तो 3,000 में रेडिसन ब्लू, 3,000 में ताज में रहने को मिलता था. तो मुझे थोड़ा लत लग गया कॉन्फ्रेंस अटेंड करने का. तो I used to always go to the number 4 and I used to take permission of Ravi sir. So 1 हुआ, 2 हुआ, 3 हुआ, 4th time गया. Sir said, तू डिपार्टमेंट में कम और कॉन्फ्रेंस में ज़्यादा दिखता है. But believe me, sir, probably I don't know. I enjoyed those conferences, but today because of that, I am organizing many conferences at Maharashtra state level. Thank you very much.
Anybody come, please? Anybody feel free to come down, please. Don't.
So I'm the other Priya from the department. And this is a story of when we were on the first floor, the olden days. We had barium and we had MMR just next to each other. The whole first floor was crowded, lots of patients standing. People would just call out names and, people would go for the MMR. It happened that there was a Induri Devi for MMR and an Induri Devi for barium enema. So what used to happen is the residents in the barium, one resident writes the names. We have these, SDs, follow-throughs, and these are the enemas. The chit goes into the room, one resident is doing the procedures. And the barium enema patients go for an evacuant enema right there, and then they move on for the barium. So the resident who did the enema came out and said, "Ye Induri Devi ka kya hai? Itna young patient ka enema kyun? Kuch symptom bhi nahi hai." she's 35 years old. So the resident who was in the room said, nahi, she's about 70. You know, she has all this typical constipations in so many days and all that. So then, obviously, you know, we knew what the problem was. And so they told this Induri Devi, अच्छा आपका अभी एक्सरे का एक भाग हो गया, अभी आप कपड़ा पहनो और उधर जाके छाती का फोटो निकालो. So the poor lady is sad because of the lack of communication, obviously. But yeah, we thought it was funny at the time.
Please, please. Aaja, jisko bhi, please don't hesitate.
So, Tufil bhai, hello, Shlok here. So,
Hi, Shlok.
as Tufil said, that JJ culture is quite different. When I came to KEM, I was for a complete cultural shock. My registrar is HOD apna Abhijit Raut. So, I joined the department and I was posted in IVU, so I greeted him and he said ki you have to be on time. That time I didn't get my hostel room, so I used to travel from Kalyan. So he said ki you have to be on time. So मैं बोला हाँ 8:30 बजे तक आ जाऊँगा. Boss 8 बजे आ जाता है. You have to be before him. So it was a very difficult time. So IVU में I did the entire day work and short call होता था 8 o'clock. And the first registrar was a very strict registrar. His name was Vijay Hanchate. So among the juniors, we used to call him Hanchy Darling. So उसको मालूम नहीं होगा. But the point is, I was too tired. पूरा दिन procedure किया था and I went and sat behind him and I dozed off. And he kept on dictating the report and he saw that I was sleeping. I didn't write anything. So in a fit of rage, he said, if you are so tired, go and sleep now. Why you are working here? So I said, okay. I picked my bag and went in search for a room and there was a dark room and I went there, I saw a cot, I slept. Then somehow I got up, it was 7:45. I said, sir, now I'm back, sir. तो बोला अभी तेरा 8 बजे का ड्यूटी खत्म हो गया, जाओ घर पे. मैंने बोला ओके सर. दूसरे दिन पूरा डिपार्टमेंट में बवाल. The point is that कि later on I made a great friendship with him. All my registrars, great people, taught us a lot. As registrars, were damn scared to call Deshi sir. तो as housemen we were क्या मैटर क्या होता है यार, फोन पे क्या चलता है जो समझ में नहीं आता है और सकपका जाते हैं ये लोग. रजिस्टर अच्छा बैठे हैं पहले फोन पे सब बात कर रहे हैं और देशी सर को फोन लगाने तो खड़े हो जाते थे. अब हम लोग भी अच्छा उस टाइम पे फोन एक्सटर्नल फोन नंबर 10 में रहता था तो हाउसमैन रजिस्ट्रार के पीछे पीछे जा रहा है और रजिस्ट्रार के पीछे खड़ा है. फोन पे क्या बात हो रही है ट्रेनिंग ही नहीं मिलती थी. तो वी वर कंप्लीटली लॉस्ट फॉर क्या हो रहा है. एक रजिस्ट्रार था, ही वाज डैम स्कैर्ड टू कॉल देशी सर. अभी क्या करना है क्या करना है क्या करना है. सो फाइनली वेंट एंड ही कॉल्ड. ही वाज सपोज टू कॉल द वार्ड और गलती में उसने देशी सर के घर पे फोन लगा दिया. सर ने फोन उठाया, हेलो. अरे सर तुम्ही तिथे काय करताय. हे माझं घर आहे, मी इथेच राहणार ना. And he kept the phone and that registrar was completely frozen. Oh shit, what have I done? मेरी वाट लग गई. I'm gone. तो मैंने बोला भाई हुआ क्या, टेल मी ना. तो बोला यार ऐसा ऐसा हो गया. मैंने बोला कोई बात नहीं, it would be fine. But later on when I became a registrar, touchwood ऐसा कुछ प्रॉब्लम नहीं हुआ हमारे साथ में. But yeah, the one थोड़ा सा sentimental एक situation है. I was again a registrar and I was posted in number 10. And fortunately, like what Priya said, RR remembered my name and he said, Shlok, go and see what is happening outside. And he gave me some work. He was so fast in saying something that पहले तो खुश हुआ कि रवि सर ने मेरे को कोई काम दिया है और उस खुशी में भूल गया कि क्या बोला है. बाहर गया, फिर थोड़ी देर बाद वापस आया. फिर मैं थोड़ी देर खड़ा रहा सर के साइड में, ध्यान ही नहीं देते थे वो. टाइप करते रहते थे. फिर मैंने बोला सर एक्सक्यूज मी, यू सेड समथिंग बट आई फॉरगॉट व्हाट यू टोल्ड मी. तो ही शाउटेड एट. अब इतना बड़ा झटका लगा कि रवि सर चिल्ला दिए अपने पे. सो आई quietly went outside the room and I was walking down the number 10 ka alley and suddenly somebody came and tapped on my shoulder and said sorry, and a tall figure walked away. So I just feel that in small instances you have taught us humility and how you should never hurt somebody, and if you feel that you have hurt somebody you should say sorry. Thank you, sir.
In radiology, you must have learned radiology. I also learned radiology, but I learned something more also. Dr. Rajan Suktankar, then Dr. Abhay Shah, Dr. Dinesh Jagesia, they all taught me. I was introduced to drinking beer. So sometimes on Saturdays we used to go out. In those days, radiology had famous parties. Every 6 months we used to have one party where those who have joined the department, for them it was used to be welcome party, and those who are leaving for send off for them. We had Vaishali Zaveri, who was 1 year junior to me, and she was niece of Dr. Bhagwati. So the Bhagwati family had gone out, so she was alone. So she said this year time's party should be at my residence, means Dr. Bhagwati sir's residence. So we were all there. I was on call, so I was not drinking beer. Everybody knew that I only drink beer. So after some time, Dr. Ravi comes there. He said, why there is no glass in your hand? So I said, no, I am on call. No, you drink. I will attend your call. I said, most of the calls are sonography. What will you do? Then Malan was there. Then Malan was listening to this. She used to stay in the campus. She said, Zed, tu pee. Me ka hali sonography to me karte. That is a human side. So he saw to it that I drink beer.
So this is, I had a senior resident who was very, childlike, very disorganized, but very enthusiastic. Kanchana karke thi. And she would generally, when she would do sonar, it would take a long time, अगर बाकी सबका काम 3 घंटे में खत्म, उसका 4 घंटे में होता. And then we used to go to, I think there was Doppler, there was procedures, there was obstetrics, and there were small parts. So she started, so it used to take a long time, but when she came to small parts, suddenly, as a jhatke mein khatam, like in 1 hour, all the small parts are done, she's out. And I was wondering what happened. So I asked her, Kanchana, what happened? And she said, see, you have to be organized. In small parts, what happens is everything is, suddenly the thyroid, then there's a testicular ultrasound, there's a breast, then another thyroid. So I organized everything. So I went out and I said, thyroid kiska hai, aa jao. So 5 jan aa gaye. So मैंने 5वां कर लिया. Then I went out and said, गोटे का तपास किसका है? There was no one came in. So it got over very quickly that day.
Okay, we'll be winding up soon if anybody wants to come. I think Dr. Hema wants the place vacated soon, right? Before I end, I want to talk about what Dr. Kuka would remember and what the seniors would remember, including Ravi. We had a famous typist called Dustekar. Dusty, Mr. will know. Dr. Kuka, do you remember Dustekar, the typist? So Ravi was neuroradiologist, obviously. So all the neurotyping reports were typed and sent to him. However much we told Dusty, कि भाई एक mistake, उसका एक patent mistake था. Arteriosclerotic के बदले arterioerotic changes are noted in the carotid. तो रवि भी ऐसा है क्या गोची करते हैं करे?
Yeah, boys. Come, boys.
So we are from 2021 batch. We have a batchmate who is from South, and he had no idea how to speak in Hindi, and he was already late. And we are posted in city in console area, and we have to manage the patient and also operate the machine. So we taught him 2 words: ki bahar jao, if patient would just come inside, and nahi, that scan will be not done. So later on he got posted in ultrasound. We again taught him few more words in Hindi. कि पानी पी के आओ या पेशाब करके आओ. So on that night he said one lady who had empty bladder, जाओ बाहर जाके पेशाब पी के आओ. So this is one short story which happened with me. After we are done with our routine postings, we are posted on call, and we would do OB scans first, and then early pregnancy scan, we would do the dating scan, and we would ask ki, what was your LMP. So we would ask in Hindi ki आखिरी महीना कब आया या कौन सा महीना चल रहा है आपका. And I asked the same thing, दीदी कौन सा महीना चल रहा है? डॉक्टर जी अभी तो फरवरी महीना चालू है. So then we had to actually improvise, like patient को कैसे बात करना, कैसे interact करना, so they also understand and we also get the proper information. So that's it.
Good evening. I am Lakshman Thadani, 1981 batch. I have one small thing to say. I was in sonography. So सबको मालूम है यूपी वाले लोगों के लिए क्या मजाक होता था. So एक पेशेंट की सोनोग्राफी कर रहे थे, पॉलीहाइड्रोमियस था, तो उसको बताया बच्चे के बाजू में बहुत पानी है, पानी भर गया है ज़्यादा है. तो उसने अपने हस्बैंड साइड में खड़ा था, उसको बहुत गुस्सा किया, गाली किया, गाली देने शुरू हो गई. तो बोला क्या हुआ? भैया को बोलती हूँ मूत मार के करो जो भी करना है, देखो मूत अंदर जमा हो गया है, अभी बताओ मैं क्या करूँ. That was real, it happened. And वो बलदेव का भी ना, he was my registrar, 1 year senior to me, Baldi. Same thing. He said na, सांस बंद. That time we used to do on rats and dogs also some studies of barium. So dog had come and unconscious rat. He again said, सांस बंद, सांस बंद, सांस बंद. That was with me also it had happened. He was my registrar also. Thank you.
Beginning phase, and we had a class on barium enema. So everything was explained, and then typical cancer sign is apple core sign, right? So one of the resident, or he was senior to me, he says, मैं जब ये apple खाता हूँ कुछ बचता ही नहीं है. अच्छा हो गया. Sorry. I was not there.
Basically, I think, Vimal, anything?
I think it's done here.
Okay, so we'll give one radiological information, CME type. End में मस्ती का उसमें. There was one resident. हीरो है तो बोला तू क्या देखा? सब देखा. बोला ये देखा, फीमर लेंथ देखा, सब. ऐसा भाई ये सूडोसाइसिस है, इसमें कुछ है नहीं, वापस जाके देख. तो he went back and saw there was no बच्चू. But a question now, what is the male equivalent of pseudocyesis? Anybody knows? Pseudocyesis, you know pseudocyesis, right? False pregnancy. People they feel like having a baby and actually don't have a baby. So there's a male version called Covard syndrome, where the husband feels the thing. And the best part is this is made use of in different cultures worldwide to trouble the wife even more. Example, north of Japan, Ainam करके जगह है. So this man fakes, I mean not fakes, Covard syndrome बोलता है उसको, fake नहीं बोलते. So he gets the labor pains, he does everything, he goes through labor pain. The wife delivers, takes care of the baby and takes care of this guy also now because it's part of the cultural thing that he had Covard syndrome.
That was an absolutely delightful session. We have a few felicitation pending. I would like to ask Ravi sir to introduce Dr. Raju Wadhwani ma'am.
Somebody unmute the computer.
तू फेल बीच में क्या बोलता है तू?
राजू मेवानी, राजू प्लीज करना.
As far as I'm concerned, she is the only one. You know the story, right? I don't remember much of her except that she was a good girl. No complaints from her, but I came to know her a little more after she left KEM and then she is now the chief of ultrasound and mammography at the Hinduja Hospital. She is an example of hard work, dedicated hard work. You tell her something, it gets done properly. And that's the reason I really respect you, because you have maintained that standard wherever you are gone. Yeah, and I'm not kidding. I'm not talking or talking sick. It is coming from the limbic system. Yeah, okay. So it's a pleasure for us to felicitate you. I have to keep thinking, felicitate or facilitate. And I hope you will keep this as a memory of KEM days and maybe forget Hinduja. Chalo, this is it. Which way is it come? Keep it in your department on Jaggi's table.
Thank you, sir. I just want to say one thing, that
Talk to the mic, no?
this coming from Ravi sir is a big thing, and I think I have no words. It means a lot, sir, to me. It means a lot. Thank you, sir. Thank you.
Okay.
Thank you.
Anything more for me? Okay.
I'd like to ask Dr. Priya Jayadevan ma'am to introduce Dr. Srirang Rani sir.
I should actually start with an apology to Rane, which is what we call him, Dr. Srirang Rane, because after Raju's introduction by Sir, me introducing Rane is like really very small. But since I was requested, I will do what I'm here to do. Dr. Srirang Rane is my immediate senior. He worked as a lecturer in ultrasound in KEM. He's a wonderful person, a great guide, a good friend. He's always there if you have a problem. In ultrasound, you know, if you do something, report something, he would call you back and say, Priya, तूने कल call पे ये report किया था, वो सही है, या ये गलत है. He's a great guide, total teacher material, and he's the person a lot of us go to if we have anything to correct or ask in ultrasound. He's a problem solver and a great person. I know most of you know him, and yeah, that's a small introduction. And he's a great personality. I don't think I can do justice to his personality with words. Thank you.
Ma'am, ma'am, you have to. Ma'am, you have to wait. You have to give.
Thank you, Priya. Thank you, everybody. One small instance about Raju. It was in my mind how hard work she was actually. Once we got a call from zoo actually, and they wanted to know whether the elephant has twins or single. And she agreed to do that actually. And me to fail, we went with her. 2 hours we struggled whether it is, and we still don't know whether it is single or not. But that is hard work.
I'd now like to call upon the stage Dr. Himangini ma'am to felicitate our support staff, Asha madam, Dinesh Patil and Meena ma'am to please come on the dais. I would request everybody to come forward on the dais. We will have a group photograph here with everyone across all the batches. Following that, we'll proceed for the game session which is arranged at our basketball court. And after games, please collect your souvenirs from outside MLT before proceeding for the dinner, which is arranged at the Dean's Lawn.
Let's go fast for the photograph.
मैम ऐसे ही एक फोटो ऐसे ही अच्छा आएगा सब सीटेड है एंड देन बैच वाइज अक्षिता अनाउंस कर
Just sit down. Sit down, please. Take the photo like this.